All right, sorry about that, ladies and gentlemen. We had a minor technical difficulty. This is the meeting of the Medical Marijuana Commission, Friday, October 29th. I'll ask to call the roll, please.
Representative Marino?
Present.
Present. Representative Villio? Here. Present. Representative Johnson? Here. Present. Representative McFarland? Here. Present. Representative McKnight?
Here. Go ahead.
Representative McKnight?
Here.
Present. Representative Presley? Here. Present. Representative Romero? Here. Present. 7 members are present. We have a quorum.
Thank you. Okay, we got a good bit to cover today. Let's get right to the agenda. First up on our agenda, we're going to hear testimony from the Louisiana Association of Therapeutic Alternatives and Medical Marijuana Pharmacies. Do we have Danny Ford? You have a white card for us?
That's it. No, go right there.
Okay. Good morning. They've got three people and 3 cards. Y'all want to introduce yourself, please?
Ladies first.
I'm Michelle Williams. We have the Medicine Cabinet Pharmacy in Alexandria, Louisiana.
Rustin Henry, pharmacist and owner of H&W Drugstore in New Orleans.
Danny Ford, representing Louisiana Association of Therapeutic Alternatives, which is a trade association for the medical marijuana pharmacies.
The gentleman in the middle again?
Rustin Henry.
Preston Henry. Okay, I have a card. Thank you.
The handwriting is atrocious, I do realize that.
No, I got a lot of cards. I just had to see which ones, who's here. Yeah. Okay. You'd like to make a statement before we start?
Yes, sir, Mr. Chairman. Danny Ford, again, representing Louisiana Association for Therapeutic Alternatives. For the committee on this, just a little history note as we went through this process. And when we first passed the legislation in 2014 allowing this, we modeled after several other states on a pharmacy based. So we are one of only a handful of states in the nation when you come to get a product of medical marijuana, you are actually meeting with a pharmacist. A pharmacist is there. Pharmacist in charge is what we call them, a pick with several techs. Compared to other states, it's a little bit different with a pure dispensary. But we did model on this system. We thought at the time it would probably be more likely that the federal government would change it from a Schedule 1 to a Schedule 2, which would go pharmacy-based, which is why we set up. So we are one of the few states that has actual pharmacy professionals in there working with the patient and with the physician back and forth on the for the dosing and the amounts. And when we started that, we came in with 9 pharmacies. Our pharmacists were actually awarded contracts or awarded licenses in, was it 18, Rustin? Or not?
Yeah, 18.
In 2018. We were operational and up. We did not have product on the shelf until really 2019. And we are slowly starting to grow and try and get this business up off the ground to help patients. Our 2 pharmacists here, 2 of our 9 are here, Rustin and Michelle, and Mr. Chairman, they're happy to give you some examples in the committee about what they're doing on a day-to-day basis, patient counts, and how their businesses are working. So I will, we're happy to take any questions and start off. So thank you.
Right, and then just for everyone who's watching information, Louisiana has actually the original thing set up with 10 dispensaries. There were 1 in each of the districts, and then
one of each,
the
each
last
of the
to be
LDHs.
Awarded at a later date, which has not been done.
Correct.
Right, and so really what I want to do is talk a little bit more about the role of the dispensary in this process. You mentioned that this is the only state or one of the only states where you can meet with the pharmacist?
Yes, Connecticut and
Minnesota.
And Minnesota. Yes, those are the only other 2.
So my understanding, the way that the program's currently working is that you, a doctor can call in, when I say prescription, I know it's not a prescription, it's a recommendation. Because everything is, we do a lot of backflips and hoops, because it's a Schedule I drug. But the doctor makes a doctor can make a specific recommendation to one of your dispensaries, and the doctor can decide exactly what he wants to prescribe, recommend for a patient, or the doctor can just send over something general, like a recommendation for THC, or that's the way it works.
Yes. We usually get a recommendation faxed over, and a lot of doctors now are making it where the patient and the pharmacist can kind of discuss their treatment, which is nice because then we don't have to call them back anytime we want to make any kind of changes. So we have direct contact with the patient and the doctor.
Right. And and so you also keep track. That's we get the patient count numbers from you, or is that who's keeping the, when they say we have a patient count in Louisiana? Where does that number come from?
That goes in the prescription monitoring program.
Okay.
So each time we dispense a prescription, we have to report it to the prescription monitoring program. So that's how they keep track of that.
Okay.
Just like any other controlled substances at a pharmacy dispense period, so any controlled substance is reported in the prescription monitoring program.
Right. And I think someone with the board testified last time we met that we've just changed the process where a patient can transfer his recommendation from the dispensary to another. How does that work?
If you decided you wanted to go to the New Orleans store from Alexandria, then we would just transfer the recommendation that we have on file. We transfer it out in the computer system too, so we no longer have the recommendation on file. It would be at H&W, and then if they wanted to come back, we would just have them come. We would just transfer it again, just like any other prescription that's transferred in the state.
And what is the patient count right now in Louisiana?
We're roughly about 14,000 right now. Overall in the program of what's come in, it was about 28,000. It's much less is what we're treating on a regular basis. A lot of folks are going to other states or going back somewhere else due to just some constraints on constraints on product, actually.
So a total number of people then that have actually participated in some level or another would be 28,000, but current number is 14?
14,600 and some change in there. I can get you an exact number if you would like.
Right. And so if we're looking, what we're trying to do with this commission is look at this whole process as a whole and see how we can improve it, how we can make it better. I think it's kind of glaringly obvious that 9 locations for the entire state of Louisiana is very challenging for patients unless you live next to a city with or live next to a dispensary.
It could be, yes. They've actually allowed us to be able to deliver now, so we're hopefully going to be able to do that. We're not busy, so to speak, compared to other pharmacies. I usually just see between 35 and 40 patients a day, and I've been a traditional pharmacist for 34 years, and I can do a lot of volume with just regular prescription medications. But so we're nowhere near where we need to be, and I don't know, maybe
You're in Alexandria?
Yes, sir.
Okay. Mm-hmm. I didn't mean to cut you off.
Oh,
I'm
no,
sorry.
no. But I just think maybe it's just lack of, we can't advertise, so a lot of patients come in and they'll tell me, it's word of mouth. That's how they found out about us. And so, and they're doing quite well, the ones that are seeing us. So we'd like the word to get out.
Representative McFarland.
Thank you, Mr. Chairman. Mr. Ford mentioned product constraints. And this may be a question for either one of Ms. Williams or Mr. Henry. Are you having trouble or is there delays in getting product?
There's been some delays from time to time. Yes, it is.
Okay. So when you have a delay, let's say in New Orleans, tell me what your pathway is. When you have a delay, what do you do?
They have to wait, or they have to go to another dispensary for it. So if I don't have a product in stock and They gotta wait.
And sometimes they have to change. You have to change their treatment, which, you know, once you have somebody stable on something. I mean, you know, we're trying to take care of their pain or their PTSD or whatever the case may be. Once you have them stable on a product, you'd love for it to continue. And then when you can't get it because it's just a supply issue, or if it's just becoming held up because it hasn't been approved, then it's an issue.
Okay, so, I mean, do we have a pathway? Do we have a defined pathway where, okay, if my product's not here, I can call, and I know we'll have some testimony later on from others. Is there not a defined way for you to get that product or to usher it in or to get it quicker? I mean, do you not have some resources available to you to expedite that product to be available to the patients?
Well, when it's available from the manufacturers, the two manufacturers, Ilera and Good Day Farms, they're usually good about getting it to us if we could have it. You know, the delay is usually not from them. So if we're running short, we can access it pretty reasonable within 24 hours.
Okay, so would you characterize it being government the problem that's delaying the product to the patient?
That's above my pay grade.
Representative McFarland, I can tell you all our members, you know, we do have the ability to transfer pharmacy to pharmacy if need be, but a lot of times what we're hearing from our members is they speak with now Good Day Farms and Ilera, and they have product, and you know it's we're still waiting on testing, we're still waiting on some other issues. There is a delay in it. They would probably be more adequate to answer that question than us, but I know it's an issue, and both of these pharmacists can tell you stories just the same as our other ones can about patients calling wanting certain delivery methods or certain things, and they just don't have it on a regular basis.
Okay, I got a couple other questions. In your dispensaries, do you offer prescriptions for any other drugs, or the only thing you can do in the dispensary is
marijuana?
Yes.
Marijuana.
That's correct.
Okay. Are either one of you
Just for clarity, they can sell in a pharmacy other issues. They just cannot sell other pharmaceuticals. So if they choose to want to sell, you know, water or cosmetics or something else, they can. None of them do, but they do have that right to do that. So just for clarity on that.
So since the legislation has been changed, House and Governmental Chairman Representative Bagley brought some legislation a couple of years ago, making it where pretty much any doctor can prescribe. Have you seen an increase in prescriptions since that has occurred?
Yes, we have.
Okay, so general practitioners now are prescribing medical marijuana for various.
Any is deemed any debilitating condition. So if a general practitioner wants to prescribe something or recommend something for a debilitating condition, he has that right. They have streamlined the process of being approved to recommend, and it's really like a 24-hour turnaround just to get it updated from the Louisiana Board of Pharmacy to recommend medical marijuana. And that's just a quick email to them and all that. So it's a lot. It has gotten a lot better since then.
Okay, that's all I have, Mr. Chairman. Thank you.
Thank you, Representative McKnight.
Thank you, Mr. Chairman. Let me ask you this. So you said there's about 14,600 patients, but that some are leaving the state because of the supply. And then I heard it's not the supply from the suppliers, it's the constraints on the product. Is that accurate?
That's what I'm sorry.
Yeah, I'm sorry. That's what we've been told, like, you know, because edibles. I mean, we had edibles for about 2 months, and like a gummy, so to speak. And we had patients that were doing marvelous on that. And then now we haven't had them for like 8 months.
And from your opinion, or why is that?
Well, we've been told that it was actually, it's Welcana or Ilera. They have the product waiting for testing results. And so they've just been kind of waiting for it to get approved.
Okay, and so this may be a question I need to wait to ask them, but the protocols for the testing, is that a supplier? Is that a regulatory?
They'll have to answer that. I'm not sure their regulatory, all of their regulatory process, but we're not involved with the testing or any of that on our end through the Board of Pharmacy or the pharmacists themselves.
Okay, I think probably the rest of my questions probably need to direct towards them, but I'm going to make a quick assumption, and I know that's dangerous, but it sounds as though there's some regulatory things that are slowing product down from the supplier into the retail area or the pharmacy area of this. I see some head nods, so I'm assuming again that assumption may be accurate.
Yes.
But I'll hold the rest of my questions for the suppliers. Thank you.
Representative Romero.
Thank you, Mr. Chairman. Are the prices standardized between the dispensaries? So in other words, if Alexandria is out and I got to go to New Orleans, is that price the same, or do you share prices?
No.
No.
The prices are individual.
Okay.
Each depends on several factors and all that stuff. But one thing we're talking about this, but one thing I want to stress to you guys is that this is medication. So we're talking about getting medication to needy people. So whatever you want to do and all this stuff, the bottom line is we're talking about medication that people need. So any hold up in people in medication means hold up in therapy. If you on blood pressure medicine and you couldn't get it, your blood pressure shoot all up. So I just want to remind you, this is medication we're talking about. Okay.
Representative Marrero, let me say this: that each of the pharmacies set their own prices of how it comes in from what they order, but you have to keep in mind in this business, and this is nothing that you guys can do about it. This is because it's federally a Schedule I illegal. We cannot, and we have a higher cost compared to other states. If you go to Arkansas, right across the northern border, they don't have a pharmacist there. They have somebody who may or may not have a college degree, who is just a bud tender, who is just giving you what you want. So the overhead is much lower. Also, we're unable to deduct any of our normal business expenses because this is a federally Schedule I drug. So any business expense that a normal business owner would be able to deduct we're not allowed to do that, from payroll tax to insurance to rent to utilities. We are not able to deduct any of that. So I would like the committee to keep that or know that. And that is, we did do a bill last year along comparative with the flower to allow us to do it on a state level to deduct make deductions, but we still cannot do that federally as long as it's still a Schedule I drug.
So, Mr. Ford, if that's the case, would increasing the amount of dispensaries lower the price because of competition?
The prices have come down some since we've started. I think having regular inventory would make the price go down. These guys kind of are in a hand-tied situation where, if you only get one bottle of aspirin a month to sell and everybody needs an aspirin, it's a supply and demand issue. And I think if we had product on the shelves in the forms that the patients are looking, that they've had the success with individually working with the pharmacists on a regular basis, we would see that. We would see prices come down some. Yes.
Is there a shelf life on the medicine?
Yes.
Is it? Can you tell me what that might be?
Roughly a year.
Right.
A year. So you could actually stock the shelf if you could get it.
Yes, sir.
Okay. So
Yes,
you
sir.
could actually have stock there
Yes.
for a long time.
Yes.
Yes.
And is that something that you wouldn't want to do because of economics, or?
Well, that too. I mean, obviously we want to be able to pay that bill, but we would love to have a lot to stock so that we would have, patients be able to have access to that. We hate being out. I mean, it's
So if you could afford it, would you stock your shelves with 6 months supply?
absolutely. Especially because we have to go and pick up our own medication. It's not delivered to us, so we have to get somebody to pick it up. And we're in Alexandria, we have to pick up from Baton Rouge or Baker.
Okay. Thank you, Mr. Chairman.
So with regards to the products, let's just go through tell me what products y'all carry in each one of your pharmacies,
Well,
dispensaries.
there are some topicals. There are the tinctures. That's the
And the topical is like a cream,
Creams.
and that's more popular amongst the older population where they maybe.
Not really.
It doesn't get into the bloodstream. It's just a topical application. So if they had a knee or an elbow or something that it works very, very quickly, but it'll give you relief not like you would if you would take a tincture or a vape form or anything like that.
It's more localized. And
Exactly.
Exactly.
So and with the topicals, you get those from both of the growers.
Yes, sir.
Okay, and do you have those in stock? Is that something that's available?
Yes, sir.
All right. So that's not when we say shortage, it's not on that product.
No.
So then what and then the gelatin, the edibles, that's something that was only available for a brief period of time at the start.
Correct.
Correct.
and not and none cents.
Oh,
And so nobody has that. No, you. I mean, you don't communicate with the other pharmacists or the other or.
We
or
could, yeah.
That's across the board, Mr. Chairman.
Okay, and then what's the next one? The tinctures.
tinctures. They're sublingual tinctures. That means they're designed to be absorbed underneath the tongue. So that's the next dosage form.
Right, and that's according to we got an email from the Department of Agriculture because they keep track of all they keep track of everything that's sold, right?
Right.
They keep track of what's delivered to the pharmacies and what's sold to the patients. So see if these numbers sound right to you. That total retail products shipped to the 9 pharmacies from the beginning of this year until from January 1st to October 18th. On the tinctures, which says including syringes, 103,563 products were shipped to the 9 pharmacies. Topicals, 4,795. Edible, 70. Metered dose inhaler, 43,473. Does those numbers sound about right to you for what your inventory and what you're selling?
Yes, sir.
And explain what the metered dose inhaler is and how does that work?
It's just pretty much like a vape pen. It's just a little small device, and then they have a cartridge that goes on top, and there's 5 different cartridges that are available for depending on the patient's needs.
How is it metered?
And it delivers, one inhalation is 1 dose. So it's not like you keep using it over and over again. Each time you use it, it's regulated, it's calibrated to give you a certain amount of dosage, just like similar to like if you had asthma inhaler, right? So 1 puff, you're getting that much. And there's some certain safeguards in it to stop you from overusing it.
So it's timed.
It's dose limited. So if you use it, it's time wise. You can't reuse it again right behind each other.
Okay. Representative Vilio.
Thank you, Mr. Chair. Representative McKnight covered my line of questioning, but since then, Mr. Ford, you commented again on supply and demand. And I just want to be clear, when you talk about the constraint on product and you mentioned a supply and demand issue, that you're talking about regulatory in nature and not that the current 2 licensees cannot meet the supply. Is that
That's our
correct?
understanding. All of our pharmacists speak with them on a regular basis, and I mean, y'all correct me if I'm wrong on it, but nobody's ever said they don't have product. It has been a delay in getting there.
That's
right.
Is that correct?
That's correct.
Thank you. That's all I have.
So when it comes to pricing, how do the pharmacies or the dispensaries? How do you get product on your shelf? You have two options for who you can purchase it from.
Correct.
You have Ilera and Good Day.
Right, and we have to go get it.
Right. So it's like, I mean, the analogy that I try to tell people or talk to people about the way we have Louisiana set up is that we decided in Louisiana that only 2 people in the state can grow coffee. And then we have 9 coffee shops that are going to sell the coffee. And you can pick from A or B to buy it, and that's your only 2 options. And then when it comes to selling it, they can only sell their product to 9 coffee shops. That's it. So how do you? So when you purchase, when you set your orders, how do you decide whether you're going to purchase the same product from one company or the other? Like when you place an order, that's the process. You place an order.
Yes. Yes.
How
sir.
often are you doing that?
As often as necessary.
Every 2 weeks, maybe every 2 or 3 weeks. And we try and stock whatever both wholesalers have in stock. We just try and keep all of that on hand so we can offer that to the patients. So whatever they have available, we stock.
Okay. And are the prices similar?
Oh, they are. Yeah, I have them priced exactly the same.
No, I mean the prices from the 2 different sources, the 2 different growers.
But like for tinctures, yes, I have Good Day Farm and Ilera's price exactly the same.
And then you decide once you purchase it as to what price you're going to sell that to the patient.
Correct.
But if I'm a patient, how do I know how much your pharmacy sells a tincture for, as opposed to, how would a patient know where they can purchase? Your prices aren't published, is that correct?
Correct.
We are going to a new ordering system, though, where it will be online. Like whenever they go to our website, they'll be able to see, which products we have in stock. It'll be like an updated inventory of what we have in stock, and it'll show our prices. And if they call us and ask us our price, we tell them no problem. Whenever a patient will call and ask what our prices are.
Do you know of any of the other 9 that actually list their price for a consumer to look at?
I think with this new software that we're doing, some of the other dispensaries are doing that as well. So they've already actually got online. We're anticipating that in the next couple of weeks. But so yeah, we were able to access their prices.
Representative Presley.
Mr. Ford, when did this program come into place in Louisiana?
2014 is when the initial bill was passed.
Okay. And we've been selling in Louisiana since
19.
Okay. And my understanding when they passed the bill in 14 was that we were kind of using other states' experiences and how we set up the program. Is that accurate?
At time, yes.
And have y'all tracked what other states are doing as far as their usage percentage-wise? Is it similar to what Louisiana is?
No, it is much higher.
So what is it in other states, percentage-wise?
Normally, in most states, it's a 3 to 3.5% of the population is utilizing a medical marijuana program. We are at roughly 2.8 to 3 of, a third of 1%. We are not even to 1% yet.
Third of 1%. Okay. And what do you attribute that to? Since we've been selling since 2019, we're now in 2021, almost 2022, really. What do you attribute that to?
Some of the constraints that we had initially, we've cleared up in legislation. We had the first real hurdle, and from what we saw, was the lack of physicians actually being engaged. There was a lot of hurdles that a physician would have to do through the Board of Medical Examiners to go in on that. That has since been cleared up. Initially there were very limited diseases which could be treated, and what we're seeing, you guys tell me if there's anything different, but the majority of the patients that are coming in that they're treating or pain oriented, chronic pain, opiates that they want to get off or try something different on that. We did not allow that to happen until the legislation, I believe that was 2018 that we did that. The pharmacies came open in 18, went in 19, so we were still from the initial bill passing in 14, we were a 4 to 5 year delay on actually getting anything up and running. For example, Arkansas passed a law 4 years ago now, and they are light years ahead of us as far as patient count and where they are and with delivery method.
So we've fixed some of the things legislatively that were the initial cause of delay, but we're still not seeing that, I guess, increase in number of folks that are able to utilize this offering from the state. Do we have a reason why it's remaining to be delayed?
It looks like for the patient count coming in, and all our pharmacists tell us the same thing. They get calls on a regular basis about from patients that they have treated before about utilizing a gummy or a vaporization meter dose inhaler, something of that. That's the delivery method that works best for the patient, and we're not getting that on a regular basis.
And do you have? I guess this probably is a better question for Canna and the folks at LSU Ag regarding what the holdup is on that. And then my understanding, well, I guess that question's also for the other group. So thank you.
Thank you.
Okay, we have Representative Romero again.
Thank you, Mr. Chairman. So just real quick, I want to understand, is the cost the same if you buy from one grower or the other? Is that the same, or is it different? Are they pricing on their own?
Does Good Day have a different price than Ilera
Between the two growers?
Extremely similar.
Okay.
Extremely similar.
So not exactly the same, but it's similar.
Exactly.
Exactly.
So you could choose to go to a different one or the other depending on price, right?
Absolutely.
or demand,
Yes.
or supply. I'm sorry. And when you talked about people going out of state to buy the product, what percentage is doing that? So are we missing out on?
Yes.
I mean, obviously we're missing out on that percent.
We're
What is
missing
it?
out.
Is that where we're short?
We are, I can tell you the pharmacy in Monroe and the pharmacy in Shreveport, both pharmacy owners will tell you that their initial patient count from people that came in that they've treated and done, a lot of those just end up driving across the line into Arkansas. I mean, obviously that's not the case for Ruston and New Orleans. It's just a logistical issue. But for folks in the northern part of the state, yes. And I think there's still a good number of folks that make trips to other states where there are more products, more availability, more different delivery methods that are readily available.
So there's really no way to know what that percentage
There's
is.
really no way to know. We know we are losing patient count to other states going over there. We can't pinpoint that, though. Those other states don't share their data in that form, and they don't have a PNP that they put in because they're not pharmacy-based, so we're not able to see that.
Thank you. Thank you, Mr. Chairman.
Representative Johnson.
Thank you, Chairman. And Mr. Williams and Ms. Ford, we were allowed to I guess, sell medical marijuana in Louisiana starting 2019, correct? So were you both a part of it initially in 2019, or did you come 2020? When did you get your license?
We got our license in 2018 in April, and then we actually had product available in August of 2019. So we opened for business since we had product then in August of 2019.
Awesome. And earlier you said you guys were initially able to sell the edibles, and then you guys stopped because the supply stopped, so you weren't able to get it. And is that also in regards, Danny? I mean, Mr. Ford, to I guess the white label as far as I think initially companies were able to begin selling products, and then through ATC and LDH wasn't then stopped approving the label because was that a part of the process? What happened?
I don't think labeling is
There was an issue. What's the issue with the medical marijuana?
With the issue, and that's more of a question for the manufacturers.
Okay, got you. And I just also, you guys, would you say since the beginning, and I think this is sort of still premature because we don't really have a full account on how much increase consumers will, I guess consumer products will be increasing because you guys have not been able to consistently sell the edibles and some of the products that folks really are interested in, right? So it's hard to get a count because you have not been able to. But would you say that since the beginning you've seen an increase?
Oh, definitely.
Definitely, most definitely. It's growing, but it could grow a lot faster if we had more dosage forms available. It's like, some people might want a edible so that it's more tolerable to their system. Some people might want something transdermal. The more options you have, the more you could tailor make it to the patient's needs.
Yeah, and would you agree? I think it was mentioned earlier that for variety, you have two sellers, wholesalers you guys get products from. Do you feel like there's enough variety right now as you're growing slowly, and you're engaged and you're learning what the patients want? Do you think these two providers are doing a good enough job to give you what you need?
Yeah, the biggest thing is capacity right now. We're not nearly up to our capacity. We could stand a whole lot more business. So as far as supply, and if you need more suppliers, I don't think that's the issue. It's just getting the destigmatization of medical marijuana to the public and get more people involved in it. So, like I said, we're just a typical Walgreens, say, might be filling 500-600 people. They might see 500-600 people a day. We're seeing under 100. So there's a lot to grow with.
Representative Johnson, I think it's too premature to tell that. We until we start getting a regular supply base for our patients and what they're seeing, I guess we don't know yet. We don't know on our end, on a supply end, on a retail end. If we get to the point where these pharmacists can call the growers and get the delivery method that the patients need and start meeting that whole population, I think that's the proper time to assess how we go forward. But at this point, as long as my non-pharmacists are sitting there and don't have a steady supply in different delivery methods for the patient, we can't make that determination.
Got you. And I sit on other committees. I know from testing and different things, all these things sort of work together as one big cycle. And so we will find out. But I'm just trying to make sure I get a full understanding that as a business owner, you guys feel that these two providers do have products that as you guys learn to maneuver, you're learning what your patients want, you're learning how much volume to order. As one representative mentioned, you can stock your shelves up to a year because these products have a lifeline of a year. And so you're learning what they want as more patients come, the patient volume grows, you're learning what products they want, how much to stock on. So you're learning as the process goes along as well, right?
Yes.
So I just want to make sure these two providers were doing a good job. It was in my opinion that they were. I just want to make sure we get on record that they were doing a good job as they are slowly expanding their products. And you guys are learning what the patient wants, making sure we don't move too quick and understand that this is still a very premature ordeal that we're in with medical marijuana. Thank you so much, Chairman.
So when you're setting your prices, you're setting prices as to what price you're going to sell a product. If you're selling only 10 units of something a week, the price is going to be different than if you were selling 200 of it. If you had 1,000 sales a week, you're setting your prices based upon the economics of running your business. Correct.
Correct.
So, and when we have low volume or shortages, or you're out of products, we're talking about being out of products while we have a very low patient count. Once we hit January, we're going. That's really when things are going to get interesting, because once we hit January, flower is now part of the equation. So tell me, how are y'all preparing for that to come online?
We really hope it's available then, because I feel like I'm telling patients all the time, oh, we're going to have edibles next month, and then we don't, and I'm not sure where the holdup is, but some patients like a flower or natural form. Some patients don't want to inhale, so they want an edible or a tincture. And so I think it's just important to have a variety of everything. So depending on what they want to need. Some patients will take an edible, but they also want a tincture or a vape for breakthrough pain or breakthrough anxiety.
Right, I'm just trying to say, but I just want to talk a little bit about what's going to happen next. It's coming in real soon when flower is available.
Well, whatever comes available, we should be able to service them. Right now, like I said, we're under capacity right now. So we have ample time, ample staffing and all this stuff to take care of them. We just need the people to come through.
Based upon other states, when you bring flower into the equation, that's going to change your patient count. Would you agree with that?
Yes.
I see Mr. Ford.
Yes, and Mr. Chairman, it would, the concern for us going into January is everybody knows this. It has been well publicized. They are getting calls, the pharmacist already, about, is flower going to be available in January? And that's when it's supposed to be, but our hesitancy is the same thing we're in now with the edibles is, do we have these folks coming in January 1 and we don't have product? Is it going to be February? Is it going to be March? I mean, we've been, all 9 of our pharmacies have been going through this with people asking and calling, and they're coming, but how long do you tell that before the patient gets frustrated and goes somewhere else, or they're just sitting there with no product? That's our concern coming in. I do agree, everything you're saying is right. The patient count should go up, the accessibility, the price comes down on flower, but if we don't have that product there and readily available, everything you're just saying, which should happen, is not going to happen.
And with regards to circling back to one of the things y'all talked about with as far as like the education component, like each pharmacist in your locations, they're keeping track of what condition a patient has, what they've been prescribed, and then making adjustments, making changes. Is that information shared amongst the different, even within the dispensaries, shared information or back to the doctors? I'm trying to see, where I know you're gaining knowledge of what works. Like for this type of condition, this physician recommended this, or this pharmacist recommended this, and then we tried this and we changed it in this dose and this frequency. Is there an education aspect to this where this information is being shared?
We have open communications with the physicians and the other dispensaries. We talk all the time. So it's a counsel. Each new patient comes in, we do a consultation. Anytime there's an alteration on their needs, we'll go over everything and all that stuff. So the biggest thing is that the PMP, everything's registered in the PMP. So if their physician wants to follow up on their therapy, they can contact us, or they can just key it into the PMP and they can follow through their therapy also.
I mean, it just seems to me that we should work into this program some type of education component where the medical community and the pharmacists are all sharing information, because you don't have a lot of research out there to give you direction like any other drug.
Yeah. Right now we're collecting analytics, and hopefully in the future we'll be able to disseminate them into say, hey, something that we could show to physicians and other dispensaries.
We keep a chart on every patient that comes in. Initially, we do an initial consultation with them, 10 or 15 minutes, and then I actually chart in the computer system what they're taking. If they come in and we make some changes, I just make the adjustments in the computer system and also on their chart. It's not actually just something that we're sharing a lot of data with, but I have it if I need it to go back on.
And with regards to all of our neighboring states, which is always good to keep in mind what our neighbors are doing right around us, because it affects us. Mississippi is, my understanding, getting ready to either any day now go into special session and start their program up.
Yes.
Which is going to be significantly different than what we are doing. And then or they're going to start in January when they go into session, and they're going to get their program up, and their program is going to be dramatically different if they pass what they're talking about passing, because they're not limiting the number of growers, they're not limiting the number of dispensaries, and they also they intend to have a reciprocity aspect of it, where someone from another state can come into their state and get a prescription filled. Louisiana doesn't have that. Is that correct? There's no component in that at all for someone from another state where they have a card, which we don't have cards, but someone from another state, if they're coming into our state, they can't obtain anything through one of your facilities unless they go to a doctor here. That's the only way.
Yes, sir.
And so, just touch on that the advertising part real quick. So the dispensaries aren't allowed to advertise anything.
We can educate, but we can't advertise.
Is that a state or a federal law that prohibits you from doing that? State law?
Yes, sir.
Is that with regards to any scheduled drugs, or just this type, just marijuana? What is it?
Just marijuana.
Just marijuana.
Right. So you can't. So there's still. So that could be a change that we could make to allow to increase awareness.
Absolutely.
Because awareness is word of mouth right now.
Yes.
Correct.
And then, as far as Mr. Ford, you since you've looked at other programs and all, how are we as far as prices to the consumers? Where does Louisiana fit in pricing to the consumer?
Mr. Chairman, I can't give you a lot of hard data on that because each state sets their price differently and how they work. I just know that we are going to be higher. Mainly, all of them have the same issues with the federal deductions. I mean, that is across the nation.
Mm-hmm. But we're high.
We are higher, and a lot of that is supply and demand.
Right.
And that issue is we're not seeing that in some of the other states.
Right. Well, I mean, the point is if the cost to obtain the product in Louisiana is high, or higher than, or even our neighboring states around us, we're not necessarily going to increase the patient count if the patient just decides I'm going across the state line. I have medicine that I need. I can't afford it here, and I'm going to legally take it back across the state line, which, I mean, Because I would say, I think it's a pretty fair statement that I'm sure that there are more than 14,000 people in the state of Louisiana that are using cannabis for medicinal purposes right now.
I think that's a fair
I think
statement.
it's pretty safe.
Yes.
And if we want to get our patient count higher, I would say the cost of the medication is a big factor to a lot of people. Y'all have any? I think I've run out of questions for y'all. Y'all have anything else y'all want to add or any? Because what we want to do too, I want to hear from you as to tell us how do you think, what changes that can we make with regards to the program as it relates to you, in order to have us get to our goal, which is access to medicine for people who need it. Tell me what you think.
You just mentioned one, advertising.
Yeah.
Allow us to advertise.
Okay. Anything else?
We'll get back with
Getting product on a timely fashion.
Yeah, definitely getting product in stock. You know, something that patients want, the product that they want, which I go back to edibles. I mean, they really want edibles. And like you said before, you know, if you have a lot of patients, then I think the price will naturally come down. If we're only seeing 50 patients a day, I mean, you know, we're trying to make, you know, be able to keep within our own budget, our store budget.
Okay. Is there anybody else from the pharmacies or the dispensaries here that wants to come in?
Just us.
You're the team?
We're the team.
All right. Thank you.
Thank you, Mr. Chairman.
Thank you.
Thank you, committee.
I think next up on our agenda, we have we're going to get testimony from LSU Agricultural Center and Southern University Agricultural Center. I'm not sure who, I think Dr. Mullins is here for LSU's, and Dr. Snowden as well. Okay, good. And sorry? Is there more than you have 3 people for each one? You can. That's fine.
Good morning. Jana Snowden with Southern University Ag Center. And I do have a presentation, and I'm waiting on it to be put up. And today I am accompanied, he's sitting behind me, but our Vice Chancellor for Research is Dr. Jose Ulysses Toledo. So basically, from Southern University's standpoint, I wanted to just give a timeline of where we have come from and how we selected our vendor, Advanced Biomedics, doing business as Ilera Holistic Healthcare. Excuse me. Okay, so we all know that in 2015, Southern University and LSU were given the first right of refusal to be licensed as a production facility, either separately or jointly. We both took the route of going separately. And as Southern University is concerned, we did opt in on August 23rd of 2016. I delivered the letter to the Commissioner of Agriculture. Following that, we did issue a RFA with a due date of June 23rd, 2017. And from that, we received 7 applications, which were reviewed by a medical marijuana review committee at Southern University. And these members were selected from across the university and the system of Southern University. And here you can see the dates in which you could submit the inquiries and respond. We had a deadline to respond, as any other RFA process.
Actually, I can't see it, but it's far away. I don't have a copy of it.
Oh, okay. Sorry about that. So the finalists were named on September 8th at a special board meeting held by the Southern University Board of Supervisors, and of that, 3 finalists were selected. Those were Southern Roots Therapeutics, Med Louisiana, and Advanced Biomedics. And of course, you all know that Advanced Biomedics was selected, and they were awarded the contract on September 22nd of 2017, and the contract was signed on May 25th of 2018. And we did do some amendments, and in that amendment, and I did provide the contract to you guys on yesterday, but in that amendment, that is when Ilera Holistic Healthcare actually came into the picture, and we were named Advanced Biomedics doing business as Ilera Holistic Healthcare. So that's where our partnership was. And of course, you all know we had to go through the federal background check by Louisiana State Police. I will tell you that this procedure took approximately 6 months to get all of our members cleared through this background check. And that's where we actually came into partnership with Ilera Holistic Healthcare. And through this partnership, and as you saw in the contract, we were guaranteed $1 million a year, with $150,000 being allocated to the Medicinal Plant Institute at Southern University. So to date, we have received $3.15 million from our vendor at Southern University as a part of this contract. Additionally, as the program grows, we are to receive, if it is in excess of $1 million, 5% of what those numbers or what that revenue is. To date, we have in excess of 15 products, and those include tinctures, topicals, and meter dose inhalers, which were discussed today. And we are waiting on our medibles to be approved so that we can be able to offer those as well.
So just talk about that a little bit more, because we've heard a good bit about that already. So when you say edibles, is that something that was offered initially? Or is this new to you?
Yes, this is new to us. So we are actually going through the SOP, the Standard Operating Procedure process right now, and we've submitted those procedures to Department of Ag and Forestry. We've received corrections from them, and we've actually returned the corrections to them, and we are awaiting the responses from those corrections.
Thank you.
Yes.
We have a question on that from Representative McFarland. Yeah, I don't mean to interrupt you going through it, but it's easier to talk about it when you talk about it.
It's fine.
Representative McFarland.
Thank you, Mr. Chairman, and I'll be quick so you can move on. Oh, can you tell me what date, when did you submit your SOP?
I'll have to get that date for you, or when Mr. Jacob Irvin comes up, he may have that specific date, as his office was the one who submitted that SOP.
Okay, can you, just real quick, do you know how long you've been waiting?
I know approximately 20 days. I know that we've been waiting on that process.
Okay. That's it. Thank you.
Representative McKnight.
That answered my question for now.
All right. Back to the slides.
And I'm almost finished. So this is just a slide just to show some of the products that we do offer. And everyone was asking about the meter dose inhaler. The middle image is the meter dose inhaler. It is a slim line inhaler. And as mentioned previously, you can control the dosages within this inhaler. It is rechargeable. You just purchase that cartridge, and it has your dosage or whatever medicine it is that you would like. Here you see the Freedom, which is for PTSD and anxiety. So this is one of the recently developed, but we do have others. Hope One, that is the autism line that we offer. And of course we have Soothe, which are our topicals.
So I imagine a lot of the specific questions about the products and all will probably be better directed towards the growers who are here, and they're on our agenda as well. But
Yes.
What I'd like to talk about is the structure that we have set up right now in Louisiana, which I think you would agree with me is unique.
It is very unique.
It's unique, right? And I think I recall from listening to the Commissioner Strain speaking that, when we initially started this program in Louisiana, it was intentionally very restricted and limited and very highly regulated. And we're the only state, and you and I have had discussions about the process. You've pretty much, you have a pretty good education about what's going on in other states, because you look at that when you make your decisions as to how y'all are going to operate.
Correct.
So are there any other states, and I know the answer, that award their licenses through universities?
No, we are the only one that has done that.
All right. And because we go through university, that makes things a little bit more, it changes the dynamics of your contracts and things. For example, your contract now with you're allowed in your contract to subcontract with the grower, right? So you're not the grower. Southern University is not the grower. The Southern University has the license.
Correct.
And according to the current structure, is Southern University allowed to have more than one grow location?
So according to what was discussed previously, we are allowed, because it does not specify that we cannot have one location. When you read the bill, it does not have specific specification towards that. So as I read it, yes, we are allowed to have.
So the law is silent as to how many. If it was not the way the statute is written, it says that that the right of first refusal went to Southern LSU. And if Southern or LSU did not exercise this right, and we went to a bid for a grower, they would only be allowed one geographic location.
That is correct.
But then the law doesn't say anything about, well, if it's Southern, right? And also, what about the idea that more than one grower? Is there any limitation as to how many growers a university could contract with, according to the statutes?
According to my interpretation of that, there is no set number.
Right. So in theory, if the university wanted to contract with 3 growers in 10 locations, that's our current system. I mean, I know you're under a contract right now because you signed a contract, but the current regulations that we're operating under don't speak to a limitation on number of growers and number of locations, because as it relates to the university-held license.
You're correct.
Okay. So let's talk about the contract. That's the other part which I was talking about earlier. Because we are going through a university, your contract's a public contract. And so the initial contract that you sent was a 5-year term.
Mm-hmm.
And there's also you can do 2 extensions of 5 years under your initial contract.
Yes.
And your contract has language in it with regards to you have a right to audit. So
we do. The university has a right to audit if we felt in any way necessary. Well, if the vendor was not operating up to our expectations, then we have that right to audit and do what's necessary for the sake of the university.
And with regards to in your contract, which we got, and all the commission members should have the contracts, as we forwarded them when we received them yesterday. There are clauses which call for how the contract can be terminated if the law changes or if the program ends. Is that correct?
That's correct.
Right, because you've at the time you entered into this contract, there was no medical marijuana industry in Louisiana, right?
Yes.
So you're pretty much making this up from.
So making it up, we actually based it off of what we had seen in, say for instance, the Colorado market. We kind of followed what they were doing as far as how we operated. We actually hired consultants from Colorado to help structure our RFA.
Right, but at the time that you entered into the contract, there was no medical marijuana program. There was no, there was no industry. There was no suppliers. There was no patient numbers. There was nothing.
That's
so in your contract that you entered into calls for an initial payment of $1 million, which was a signing bonus or initial fee. Mm-hmm. And then it requires the grower to pay the university $1 million per year
Yes,
And you are roughly, what, halfway through this 5-year contract?
that's correct.
So that's how you have 3.1,
1.5.
because you have the initial $1 million for the first year, $1 million for the second year.
Yes.
Then the next payment that'll be due to the university will be when?
January 1st.
Okay. And talk to me about the research component. There's components of your contract that talk about a research. Supplier shall work with supplier's grower.
Mhm.
Shall work with Southern to develop a sustainable research center to enhance Southern University's medical cannabis operations. Talk to us about that.
Yes, so through this partnership, the Southern University for Medicinal Plants, in which I direct, was actually brought into being or initiated. So being we have this new Medicinal Plant Institute, we wanted to have an avenue for students to actually be able to come in and study this, because although we did not have a market here in Louisiana, we've seen what other universities have done, such as Colorado State University, and how their programs have grown just by initiating medical cannabis or a cannabis curriculum. So being that, and one of the things we were very strategic in doing and intentional is selecting a candidate who had the wherewithal and also the capacity to not only provide the revenue for the university or to enter into this endeavor, but also had the capabilities of coming in and building a program for us. And with that, we wanted to make sure we had individuals, or that this group would also work with the university to help strengthen capacity at the university. So that is where the research endeavors came in. And as this program grows, we've had a couple of students to come through the institute, 6 to be exact, but we want, such as if we are developing new strains, and as you all know, industrial hemp was given to universities recently. And with this, we've actually trained students in industrial hemp, knowing that this plant is very similar to what we will be doing in medical cannabis. So we're able to train students for the workforce in this area, and research and development is a vital part of that.
And with regards to actually doing research, is the university actually doing research on therapeutic cannabis?
Not at this time.
Not yet? That's in the plans to go forward to do that?
It is. Right now, we actually work with other medicinal plants such as hibiscus. We've actually done studies with high blood pressure, diabetes, and we're looking to bring similar studies utilizing the cannabis plant. And also, as we receive information and data from pharmacies and from physicians as to how patients are responding to different medicines, we're going to use that information to move forward with our research endeavors.
Right. That's a big part of, I think, that we're not doing or not meeting the patient's needs right now by educating the medical community and the pharmacists as to the therapeutic cannabis. So the ownership of the so you have a current contract. And your contract requires the location to be of the grower to be in East Baton Rouge?
So the contract does not require them to be here, but it was kind of desired from the university standpoint, and that was done so because we did look at an operation in West Baton Rouge previously before we selected the Baker location, but we needed somewhere where we could. Although students are not able to go to that facility, myself, I needed a place where I could actually, be able to travel and, not have to spend 2 hours on the highway, to get to a facility to actually regulate or, oversee that production. So that's why the Baker location was selected.
And you're also, you have the provisions in your contract regarding the changes of ownership.
Correct. Anything over 5% has to be approved by our board of supervisors. And again, that was done intentionally. And one of the reasons being is we wanted to make sure that the resources derived from this project were, they stayed in the state of Louisiana. And that's why we actually set those provisions in that contract.
Is there any requirement in Louisiana, in your contract, that the grower be a Louisiana company? Or?
In the contract, I don't recall if it specifies if they have to be a Louisiana company, but we wanted majority ownership.
That's the board's, and that's what the board wants to, but it's
Correct.
not, I don't think it is
It
spelled
didn't.
out in the contract.
It's not spelled out.
But that's your objective.
Correct.
With regards to ownership, because you want to try to make sure that all of the money is going to stay within our state.
Correct.
Okay. Another thing which I've found a little bit interesting in the contract was that the pricing is approved by the initial pricing would be of the products that would be produced would be approved by the university, and then any changes, increases or decreases. Can you talk to us about how that works?
Yes, so again, this is intentional. We did this because we wanted to make sure that our patients or the stakeholders in which we serve in the state of Louisiana were able to afford the medications. So we wanted, Ilera to come to us for the pricing so that we can make sure that those costs were low on our side to the dispensaries, so that when it gets to that level, it didn't have to be increased so much, so patients could have access to it. Especially the patients that we serve, and at Southern University, we do serve underrepresented groups. So we wanted to make sure those groups were receiving that medication or had the ability to receive it.
So that's the process that's still going on right now? If they want to make a change in a price of a product, they've got to go through the university?
Correct. And through the university is just basically myself and my chancellor of the Ag Center. It doesn't have to be approved by the board. It's just the chancellor's approval.
Okay. And then how is the pricing? How do you come up with how do you determine what is a good price to sell to a dispensary?
These numbers are, it's brought to us by Ilera Holistic, but these numbers are based on what has been seen in other markets and, how these products move in those markets, especially with the demand and the number of patients in those markets.
So how would you say it is? For a patient in Louisiana, we've already been talking about, what it appears that Louisiana is a pretty high place. The cost is pretty high in Louisiana for a patient to purchase cannabis, and it's not covered by insurance.
Correct.
So
from our standpoint, I do believe that we do have a lower priced product that goes to the dispensaries. I do believe from our standpoint, based on, what has been seen.
Is your pricing based upon comparing what the other growers' prices are?
It is not. We don't actually know their pricing.
Okay. I'm trying to remember all the things that we just talked about. We had a long conversation. I'm trying to put all this out so that one of the other commission members, but to anyone else that wants to know about our program can understand the agreements that are with the university. So the current contract that you're operating under right now you're about halfway through. You have about 2.5 years remaining on that contract, and then the university can decide whether to renew the contract or change the terms.
That's correct. Yes.
All right. Any of our commission members have any questions for Dr. Snowden with regards to Southern's program? It does appear to me that the patient care part of it is something that you're heavily interested in trying to make sure that we're going to get medicine to patients.
Yes. And with that, education, we've spoken about education being a main component. What we've tried to do, Southern University Ag Center and the Southern University Law Center have partnered together to hold cannabis symposiums so that we could educate physicians and those wanting to be in this space. So we plan to continue to offer those type of workshops and, just to educate right now to get people more involved, because as you've heard, everything is word of mouth right now. So that's what we're dealing with. That's what we have to work with, and that's where we are.
Are there any suggestions that you could recommend to this commission as far as the licensing process, or anything that you think we might want to look at or potentially update?
So that advertising would be one that we would be, it would benefit both universities and also our patients. And that's one of the things, like we do word of mouth, but you still have those communities, those lower economic communities that still do not know about the medicine that we have. So that education and advertising would be a main component.
And what are the challenges that you see with this still being a Schedule I drug in federally, with cannabis being Schedule I? How does that impact the university and in the program?
So right now, it does not directly affect us because of the fact we have a third-party vendor. But if the universities were to do this themselves, of course that would affect we feel that it would affect the dollars that we've received federally. So we did not want to mess with that at all.
Right. So if and when the federal government makes a change and stops saying that this has no medicinal purpose and take it out of Schedule I, we're still working around that.
We're working with it.
Right. Thank you, Dr. Snowden.
Thank you.
Well, I believe we have Dr. Mullins with LSU Ag Center. Do we have other people as well, or? And we covered all your slides?
We did. The last slide is just economic development. I wanted to show the capacity that has been built in the North Baton Rouge area, which is where Southern University is located. And in our contract, we wanted to make sure that we brought resources, more revenue to those areas around us in which we serve and the state. So that's just what I wanted to let you know. We've brought on this number of employees, which is 33 to date. We're still onboarding, and we will continue to do so as this market grows.
Thank you.
Thank you.
So we're going together?
No. Yeah, I'd rather have the university come up first.
He has to present from it as well.
Yeah, and then we're going to go back to get back to Ilera.
I'll put it down here to you.
Hello, I'm Dr. Ashley Mullins with the LSU Ag Center. We had prepared a presentation to go together. So my presentation is the last piece of paper in the document that I think you received.
Okay. Yes. So just state your name for the record, please, Dr. Mullins.
Dr. Ashley Mullins with the LSU Ag Center.
And you have information. So your slide that you have is with regards to the contract, or LSU's contract for agreement for services. That's the one
Yes,
that
with
you-
some background information that I was going to provide.
Okay.
Let me get started.
Yes,
so,
please.
Yes, just a little bit about how we got here, and Dr. Snowden kind of touched on it. So, this law was passed in 2015, the Allison-Newstrom Act, and neither the LSU Ag Center nor Southern University Ag Center was in that bill. We weren't even watching it. So in 2016, the law was amended. So the initial law only had one cultivator, which was going to be a private entity along with the 10 pharmacies. And in 2016, my predecessor was in governmental affairs was having lunch, and he was called and said, "You better get back to the Capitol. They're about to write the ag centers into the medical marijuana bill." And so he rushed back down here, and we were given the option to opt in while we could do some background information, some research before deciding. So something important to us in that was it changed the one cultivation site to the two of us, the two ag centers, and it added a research component, which was really important to us as a land grant institution. So after doing a lot of research and visiting other states, and same as Southern, just assessing what was going on in the market nationally, we decided that we could not spend the $15 million that we estimated it would cost to get this program up and running of public dollars when we were already cutting other programs like 4-H and food and nutrition and things in our parish offices. So that's when we decided to do a solicitation for offers. So prior to September 1st, 2016, the LSU Ag Center exercised our option to be a licensed production facility for the state of Louisiana's medical marijuana program. In February of 2017, the Department of Ag recognized that and sent us a congratulatory letter as a licensee. So I think it's important to remember, and if you're involved in this, you probably have watched some of the video of when the law was passed, but the two universities, the two agriculture centers were written into the bill to provide a buffer. We both have what is known as sunshine laws. We are a public bid process was utilized, public record. We both have board of supervisors that vet all of our contracts. And we obviously represent the brand of LSU and the LSU Ag Center. In addition, we were written into the bill to provide a revenue source for higher education institutions that had taken major cuts over the last 10 years. So as a land grant, we are the entity conducting agricultural research in Louisiana and taking major cuts, not having students, as you all are well aware of, serving in the legislature. This was a way that they could bring an independent revenue source to the two agricultural centers while conducting important agricultural research, specifically on medicinal plants. So through the public bid process, we entered into a contract with our selected vendor, and that was signed in September of 2017, and you have that contract. And over the next 18 months, we helped our vendor get through suitability, which is a very extensive background check that is conducted by state police and ag and forestry.
The initial, the contract that you sent over to us yesterday, which is the initial agreement for services contract, that's the September.
Yes.
It didn't include it didn't include the page on the pricing or I mean the revenue to the university. It references
Appendix 1, it wasn't in there?
No, it says it references a document called Supplier's Best and Final Offer. Right.
Oh, that was in their bid. So that's not part of our contract. I'm sorry. I guess I can send that. I did not. That was an oversight. That was in their best and final offer.
Right, because that's the part that I'm, primarily interested in is the revenue.
Well, it's referenced, I think, in the Appendix 1. I don't have the contract in front of me. The very last page of the first contract.
Right. Go ahead. I don't.
Very last page of the first contract, I thought, has the payment, but mainly. We were to receive and have received $3.4 million. That was before we got any sort of percentage. Is it on there?
No, it just says reference 1 payments appendix payment schedule, but there is no payment schedule.
Okay, I can. I'm sorry, I can provide that later. That's part of the bid.
That's part of the reason why I was trying to get you to send this to me before yesterday, so that I would have a chance to look at it and be able to see if we have everything, so that we could be prepared.
I can answer any questions that you want.
Well, I know. That's why we're here.
Right.
But I'm just saying it would have been, it would have been nice to actually seen the whole contract that the university entered into, and that the payment part of it is a big part. But go ahead. So you can explain it to, and then, well, the initial contract has been amended, so the payment terms for the first contract are changed.
Correct.
So the payment terms are now. Explain that to us. What is the revenue to the university now under the amendment that y'all did in when was this? This is with the Board of Supervisors and GB Sciences, and this is what in 2018, right?
We signed the first contract in 2017, and we amended the contract in December 2020.
Okay. So now we're operating under the 2020 version of it.
Correct.
Okay. So talk to us about the revenue to the university.
So in the first contract, we were set to receive at a minimum $3.4 million, also a 6,000 square foot research lab that was equipped. All of those were met. We are audited every year, and so all of those payments have been satisfied by our vendor. And so we renewed our contract and extended it in December 2020. Again, this was vetted by the LSU Ag Center and approved by the Board of Supervisors. And so it just positioned us as a more clear payment structure with our vendor as the program flourished. So what we found out from our first contract was setting a 10% gross payment on gross receipts was not allowing the program to flourish and meet the mark, and it was putting a lot of strain on our partner, a lot of financial strain, and it limited their ability to do business. And so we took a look at that, and we realized that the program has been much slower to get started than any of us thought. And so this allowed us to let them, as they make a sale or as sales are made, then after the fact be treated like a true investor, a true business partner, and receive payment after that. So the only payment we've received so far from that amendment is $1.3 million at contract signing. The next payment is due at the end of the year.
So in the current payment schedule to the university is it's stepped up on the amounts that are going to go to the university based upon the date, right?
Correct.
So initially it's 1.3 when y'all re-sign that agreement, and then 400,000 due on or before 2022, the first day of business 2022, 368,500 due before the first business date of 2023. Is that the current agreement?
Yes, it's the current agreement.
So to date, from when we started, and LSU and your agreement with your vendor, that you're ahead of Southern in actually getting the product.
Yes, we were the first to market in August 2019.
So how much money has the university actually received to date?
We've received approximately $4 million.
Okay, and break that down for us. Where is that? Is that a certain amount from the original contract, and then a different amount from the amended contract?
Yes, and it's still the same partner. It's GB Sciences Louisiana. We have had the same contract with GB Sciences Louisiana. They've now been invested in by Good Day Farm. John Davis has worked alongside of me since the beginning. He is still there. So we feel that it's just an amendment and extension of the initial contract. So yes, we got paid off the first contract and now the amended contract.
So going forward, LSU is this contract. When does it end?
2027. And it's important to note, I feel like everybody should understand, and I think one of the pharmacies, or maybe Dr. Snowden, hit on this. This contract was negotiated in December based on the current structure of the program. So we are grateful that this group came in and was willing to invest the capital into this program in Louisiana, into our university. And we do have concerns. Any change in this program, any expansion of this program could possibly put us in a bad position, with what was agreed upon just in December. So we have extended until 2027. The current sunshine is 2025. And so we have just begun, this extension, and just hope that you can take that into consideration, that this group has moved in and not only made payments to the university, but have expanded to their Ruston facility and planning to invest about $50 million.
So does LSU, Southern's contract, they have to be notified if there's any change of ownership and more than 5%. Under the amended contract, LSU doesn't have a right to reject or approve a sale of any transfer of ownership.
And I don't think we had that in the beginning. We just had to be notified. I could be wrong. I'm not a lawyer. But we would not stand in the way of a business transaction.
Right. No, I'm just saying that I'm just going through the contract. So the extension you did in 2020 extended it for 7 years.
Yes.
But LSU doesn't have the right to have any say in if the supplier changes ownership.
Correct.
At all.
They will have to go through suitability with the Department of Ag and Forestry and State Police. But our new contract, which was another really important thing to the Ag Center, is if they get a large buyer, we do get 2.5% of proceeds if they do sell the company.
Right. So there's a buyout participation. The supplier will pay LSU 2.5% post-tax net proceeds if they sell the company.
Yes.
Right. And what about the original contract had a research component in it?
Correct.
And the extension deleted it. Is that correct?
Well, I think it was mandated. We just kind of changed the payment structure. We're still doing research. We're using the funds that they have provided to us for research and just the upkeep of our program. We formed a Therapeutic Cannabis Research Committee to vet proposals. We have about 8 projects funded for about at approximately $550,000 is what we've dispersed so far to Ag Center faculty. The first priority was to get the products to patients, and research was something that we feel is most important to the university and the patients. It's just a long-term game. We are partnering with Southern Ag Center. We've had conversations with the health science centers in Shreveport and New Orleans and Pennington. So that's something until recently we weren't really sure with the slow growth of the program when we could get the proper funding to equip our lab and get that research going. So that's still really important to us. We hired a research director. He started this summer. He's working out at the production facility, and we are conducting research on not only industrial hemp, but therapeutic cannabis.
Okay. And I don't want to just, I've just pointed out to you that, the original contract that you had said that Supplier and Ag Center will develop an educational program relative to medical marijuana for patients, providers, and dispensaries. And the new contract deletes that in its entirety. So I understand the university is doing it, but it's not part of the agreement anymore with the supplier.
It's not part of the agreement. It is important. Unfortunately, we have put up what we deemed as educational information, and it was told to us it was considered advertising, and we were told to take it down. So we've tried to educate as much as we can underneath the.
Right, because we're dealing with Schedule 1, so we have to, right. No, I understand that. We have a lot of challenges that we're working with, and if and when the federal government makes a change. Representative Vilio has a question.
Thank you, Mr. Chair. Ms. Mullins, is it fair to say that when LSU engaged with its selected vendor, there were no companies at that time that wanted to take the risk in light of Louisiana's heavy regulatory environment?
That's correct. I think we were like Southern. We received 7 bids, and 3 were what I would consider viable.
And the vendor that decided to take the risk in addition to its investment, as I understand, if I understand correctly, paid LSU initially $3.4 million?
Yes.
And that was based on the framework as established by the legislature with the sunset provision of 2025, correct?
Correct, yes.
And that's even before the expansion of the list of diseases and before the passage of flower?
Yes, correct.
Thank you.
Thanks.
Does LSU, thank you, Representative Vilio, does LSU have any part of the pricing of the product? Is that, you're involved in that?
You touched on this with Dr. Snowden. Our first contract said that we would approve because, like you mentioned, there was no existing program. None of us really had an idea of what we were getting involved in, but we did a lot of research, and then we would formally approve their initial wholesale pricing. Now that the program is up and running, we consider our partner, Good Day Farm, the experts. They're doing this in other states. John Davis and his group have been around since the beginning, and so they bring the pricing to us now, and we can weigh in, but there's no formal approval process other than myself and the Vice President of Agriculture. Just if we have any concerns, we raise those.
And actually, I think it in the amended contract it deletes entirely the part about the university having approval or any say in pricing. The amended contract and price for product shall be deleted in its entirety and amended to within 5 days from a written request. Suppliers shall provide Ag Center of all pricing information. So they just give you. When they make a change, they just send it to you.
Right.
But it's not. So are you aware of like whether how the prices are set or anything that's totally not within the university?
No, and they bring us analytical data from other states. I mean, they will show me graphs, PowerPoints about how they're getting to the prices that they're getting to.
Okay. And then everything else to do with like which products they have and how they're being produced and what their plans are going for. That's all going to be with the grower. Not the university is not involved in
correct
selection of any types of product. And so tell us what you think that we on the licensing end, which is why I was saying that I wanted to have you come up because I wanted the order we're going through this agenda is we want to talk to the pharmacies, the dispensaries, and then the license holders, and then we're going to talk to the growers. That's why we separated. But tell me, as far as the licensing component, do you have any comments or anything as to ways that we might change or amend, or what we should look at from the licensing component?
As far as the two ag centers are the licenses,
Right.
licensees, holders. So I don't think there's any changes because we just opted in, so there's nothing there. As far as suitability, we've spent 2 of our 4 years of existence in this program going through suitability, and so that just some operations have to stop when that process is occurring until LSP and LDAF can vet our partner. And so obviously, if you were a business owner, 2 of 4 years is a long time to have to go through a background check.
So does the money to the university change as far as the payments that are owed to it when we have a change in ownership and they have to go through suitability? Basically, when they have to go through suitability, they pretty much have to stop, right? They can't be dispensing products to the.
They can dispense. No new activities can go on. So, for instance, if you get a new piece of equipment and you want to get it inspected and new SOPs approved, none of that can happen. You can continue business as usual, so no expansion. So,
but it doesn't affect the contract with LSU as to how much LSU is entitled to receive as far as annual payments.
No, I mean, I would say the better our partner does, the better we will do. And we've never surpassed the minimum payment that we were provided for in our contract. We've never made any percentage of sales, and we've never benefited from their profit because we haven't ever crossed that barrier.
They've got to get up to bigger numbers. So according to what the document that you have for us, the annual payments under the current agreement, which y'all signed in 2020, then that also has a 5-year renewal option as well, right?
Yes.
So what is the next payment that's due to LSU?
By December 31st this year.
And what is that amount?
That is going to be the $500,000.
And then in 2022, it would be greater of $1 million or 3% of the post-net proceeds.
Yes.
In 2023 is $1 million or 4% post-net proceeds. 24 is $1 million or 5% greater of.
Yes.
These are all greater
Greater
of.
of.
It's either $1 million or.
It just stair steps as we hope the program grows.
2025, $1.5 million or 7% post-net tax proceeds, and then 2026, $1.5 million or 7% post-net tax proceeds. And then 2027, it says, if renewed, greater of $2 million or 7%. What does that mean, if renewed? That's not part of the current contract, or that would be the next contract?
The next contract, yes.
So it really ends in 2026?
Well, I'm not an attorney, so I could be misspeaking, but we have a contract through 2027. Okay. But I welcome you. You can talk. We have outside counsel and LSU general counsel. If you'd like to discuss our contract in depth, I would.
Yeah. Well, I mean, I don't want to just repeat the same thing, but if I'd had this maybe more than 24 hours ago, I could have had more questions on and directed them to the right person on that. So is there the amendment that we have that says what the terms are doesn't have those numbers in it, the million, 1.5, 1.5. The only thing that I'm looking at that has any kind of payments on it from the LSU contract is that 12-page amendment. And that says, $400,000 due or before the first day of 2022, $368,500 due in 2023, $300,000 due by 2024, and $300,000 due by 2025. Is there another document or contract or amendment that?
No, that should all have that in the amendment.
Well, the payment terms don't say what the slide says. So do you have a document that has something with these payment terms in it?
I'll have to check.
Yeah, because I'd like to see that, actually. Because I've went through the entire contract and the amendment, and I don't, I'm not. I'm glad that those are the numbers and they're better for the university standpoint. But I don't have a document, so could you, please
Sure.
make sure that. Okay. Yes, it is. Here it is. There's okay. So what I'm reading, because I'm, rushed through it. I think what I was reading. That's the research investment part that I was just reading to you.
All of those terms have been changed. There's no more research investment. It's just payments based on. So it's weird the way that our procurement makes us do. It has to scratch through and reword instead of just doing a brand new document. You have to look back at the original contract.
So, the research component was deleted, but payment terms. Section 3.1, this is the 12-page amendment. Research investment shall be deleted in its entirety and replaced with Section 3.1 settlement payment. In exchange for the execution of this amendment and the renewal of the agreement for an additional 5-year term, the first supplier agrees to the following payments: $1,300,000 due upon execution of Amendment 1, $400,000 due before the first business day of 2020, $368,500. That's all in there. So that's towards research.
That's just a
Additional payments. But then the agreement, the where the money part comes in is on the second page of the 12-point amendment.
Right.
It is in there. I'm going backwards now. For sales of medical marijuana produced in Louisiana from January 1, 2021 through December 31st, 2021, $500,000 on or before that. So that's the next payment.
Correct.
So if we want to look at what LSU is going to receive in income, it's in this document, and we can look at it going forward, and we can assume that it won't be less than $1 million a year, unless the sales significantly change in the next. Excuse me. Representative Vilio has a question.
Thank you, Mr. Chair. Ms. Mullins, am I assuming correctly that LSU's records requests, for any records from LSU, they're subject to Louisiana's procedure for public records requests?
Correct.
All right. Are you best positioned to discuss the regulatory bottleneck, or had LSU's grower been prepared to discuss that today?
That would be our partner.
Thank you very much.
Thank you.
Okay. Does LSU also have a right to audit the books of your grower?
Yes.
And there's also provisions in your contract with regards to the termination of the contract or ending the contract if there are substantial changes in the law.
Correct.
Right, or obviously the one where if the current program isn't extended past 2025, which it sunsets right now, right?
Correct. Yes.
Right. So if we did make changes in the law going forward, and it substantially changed the way the program is administered, then LSU and your grower does the contract terminate, or do you have to renegotiate, or what happens if we make changes? And that's a legal question.
That's a legal question. I know. I'm like, I hope it wouldn't terminate, but I'd have to get my attorney to weigh in on that one.
All right. Okay. All right. Thank you, Dr. Mullins.
Thank
I don't see any other questions for anybody with regards to LSU? Thank you.
Thanks.
So it doesn't really matter to me the next part of our agenda is the growers, and we have Good Day Farms and Ilera Holistic. It doesn't matter to me if y'all want to go together or apart. I mean, it's that you're on the program now. You two decide. You want to flip a coin, or you want to come up together? Why don't you come up together, and then you can at least if you have questions, it'll be easier than running back and forth. Go ahead and do the introduction part, please.
My name is Jacob Irving. I'm the Director of Compliance and Government Affairs at Ilera Holistic Healthcare, as well as the Operations Manager.
My name is John Davis. I'm the president of Good Day Farm, Louisiana.
Thank you. Okay, so let's start with. Is there anything that I guess we can start with Mr. Irvin. Was there anything you want to, any introductory remarks you want to make, or?
Sure. Yeah, I'll just a little bit about my background. I'm a cerebral palsy patient, so while I got into it, I testified with Allison Newstrom in 2014. So I've been working on improving the program since then. Went to law school, specialized in cannabis-related regulatory law. Really wanted to do this. A little bit more of my background, was entitled to medical marijuana under the old medical marijuana statute. I was born in 1992 with spastic quadriplegia, so it's been a passion project of mine to really work on make sure that this medicine is accessible to people with cerebral palsy who are in the same situation I was growing up, because I think it can help ameliorate some long-term musculoskeletal defects that happen when kids are growing taller and growing, and their muscles are still so spastic that they don't get properly stretched out, and that causes bone issues and long-term issues that can't be properly addressed and are best addressed in physical therapy. So I did a couple decades of physical therapy, and it just wasn't enough. So I'm really passionate on making sure that in the future this is enough for the children of Louisiana.
Okay, so you've heard. Well, we started out with the dispensaries, and they were talking about products and product availability. I want to discuss that with the commission as far as supply and let's just start off with this. You're two Ilera. What are the products that Ilera currently offers to patients in Louisiana?
Sure. Currently, we offer tinctures, topicals, and metered dose inhalers. I think we have 7 SKUs of tincture, 2 SKUs of topicals, and 5 SKUs of metered dose inhalers. The metered dose inhalers take the form of the PAX pen, which basically each pen has a set of microchips in it, and then each cartridge has NFC technology. So what happens is that pen can communicate with the device, and then it's metered by developing exact pulses of electricity into the each pod, which is SKU specific, and we run experiments to determine what that dosage is, and then provide it to the pharmacies.
On that metered dose inhaler, according to what we got from the department, it looks like metered dose inhalers provided to pharmacies. I keep wanting to say Ilera. It's Ilera.
Yes,
right?
sir. Ilera.
Ilera, it says from year to date, which would be January to, the 18th. Ilera, 43,337 metered dose inhalers. Does that sound right?
So I didn't prepare that, but it sounds like it could be accurate.
And then with Good Day Farms, it says 136. Is that not something that y'all produce, or?
I've never seen the report, so I really can't speak to it.
I mean, as far as like 136, it pretty much sounds like that y'all don't provide metered dose inhalers.
Well, we don't provide metered dose inhalers. We, because of regulatory issues, provide a deconstructed metered dose inhaler.
What is that? What is a deconstructed?
Just that. Instead of the constructed metered dose inhaler, we provide a deconstructed one. We give all the parts to the pharmacies, and those parts are provided to the patient, and they can then construct it themselves at home.
And what are these parts that the patient is constructing?
The metered battery, the cart or cartridge, and then the concentrate that goes into the cartridge.
So why is it sold that way? It's deconstructed.
We are waiting on approval from the Department of Ag and Forestry on our SOPs.
Okay, so that's not your intent to go forward to sell it in pieces.
It is not our intent to sell
okay.
a deconstructed
I was just asking
vehicle.
because it didn't. That sounded a little unusual.
I would agree with you.
All right, so
but
if the department approves your SOP, then you can sell the metered dose inhaler as a.
Yes.
Okay.
I agree with you. We would like to provide the patients the final and complete product rather than asking them to construct it on their own at home.
Right. And then so what are the products that that Good Day Farms provides? So is that all of it, Mr. Irvin? The tinctures, the topicals, and the meter dose inhalers. Do y'all do edibles for?
So we are currently awaiting our medical SOP. If I could just touch on the SOP process for just a second.
Please.
I believe that this is a regulatory bottleneck that we are all currently experiencing. Product shortages that pharmacies want, to me, fall into two categories, right? There are potential shortages with products we already offer and we get approval for, and those are incredibly rare. To date, we have only had one interruption when there was a sudden change in the testing requirements. That interruption lasted about 2 weeks, and I can touch on that in a second too. After the most common interruption is really as far as standard operating procedures go. There's a requirement right now that if I want to turn on a new piece of equipment or release a new product, there's a very lengthy standard operating procedure. To demonstrate just one way that this might affect us, we harvest a lot of marijuana biomass in our facility right now. It's hundreds and hundreds and hundreds of pounds every week, but I'm awaiting permission to turn on our automatic trimmer. So right now I have my whole staff, mandatory minimum hours of trimming each week, myself included. No, I really don't have great use of my hands. I'm not a very good trimmer, but we, to get through it, to maintain supply. So just different things like that create an issue where, for those who don't know, I guess I should have backed this up. In order to make something like a meter dose inhaler, the marijuana has to be extracted. In order for it to be extracted, it has to be trimmed. You can't just take the full plant on the branch and put it in the machine or it will break. There's also a minimum amount of plant biomaterial that has to be loaded into a machine, or else there'll be nothing to distill, because the marijuana oils have to be extracted and then the individual compounds are distilled afterwards. So if there's not enough material before the distillation, then you'll have wasted all of your product. So trimming becomes a major bottleneck. When it comes to new products like the gummies, there comes, I would say on an average, about a 4-month SOP process for new products. There's different communications. Generally, I'm sorry.
If you want to introduce a new product, we're talking about a 4-month turnaround?
At least, yeah.
and that's within the, and so explain the process. You
Yes, sir.
come up with a new product that you want to introduce to patients.
Yes, sir. If I come up with a new product to introduce to patients, in this case, the Medable, right? So we would come up with an SOP, which would...
The SOP is...
I'm sorry.
SOP is abbreviation for...
Standard operating procedure. I'm sorry.
I know you know that. Everybody might know.
Yes, sir. Sorry. So the standard operating procedure lists everything, and it's become more and more detailed since my involvement. These days, they want to see the cleaning of the equipment, how the machines get broken down, diagrams of the facility, all the ingredients listed, and then what happens is I put all that together and I send in that SOP, and then await my first set of comments back, and then upon an appropriate amount of time, I know that they've got some staffing issues over there, which I've been told. So, but some time passes and I get the first set of comments back, and then we address those comments and we send it back, and the process continues until we receive approval. After we receive approval, we schedule a site visit for them to come out and look at the equipment. After that, we are allowed to begin manufacturing. So,
Is that sound about? Do you agree with that time period, Mr. Davis, if you were going to introduce something new, that you're generally looking at about a 4-month turnaround?
Yes.
Okay.
Just for an example, I know our most recent comment on just to answer Mr. McFarland's question, the most recent turnaround on the Medibles SOP, was that we turned in some this month and we're waiting on approval. But I think we turned in our first draft. If you actually back up, look at the fact, I want to say that was a June or July thing. And this can be, and I understand where it's coming from, because we are trying to make a pharmaceutical grade product. But for me too, we're always very price conscious. So just one thing that happened in Medibles is I'm always looking to decrease my cost of goods sold. So I'm looking to change that gelatin base as often as possible to get down, because patients don't want to be paying for gelatin, they want to pay for medicine. And so every time we want to change one of those processes, we sometimes can start over in this process. And so if you leave me as a business operator for a 4-month period, I might have some new ideas during that process. We're back there working. We're trying to get these costs down as much as we can. And so that can be something where eventually we just kind of go with what's standard because there's a very slow process for change.
And does Ilera operate in other states other than Louisiana?
Currently, no. So background history on that, and this confuses people, so I'd love to clear it up right now. Ilera, when they first came into Louisiana, was a Pennsylvania company that was opening a branch in Louisiana. That Pennsylvania company was acquired by a Canadian publicly traded company called Therapeutic. So we no longer have any affiliation with them. Our owners, the different owners, have had different investments in different states, but we are solely a Louisiana operating company.
Okay. Representative McKnight.
Thank you. I have quite a few questions here, and I have a lot of notes on a couple different pages, so excuse me if I'm out of order in line of questioning. So
I'll turn your mic off if you go too far.
Thank you. I appreciate that. From the pharmacist earlier, as y'all heard, I made an assumption, and it continues to build, and it sounds like my assumption's correct. My first question is, each of you have excess product sitting on the shelves trying to get out the door right now?
I'm sitting on, I would say roughly, and it's tough to compute because some of it's wet weight, but between 700 and 800 pounds that I would like to process as soon as we get to trim it.
The biomass or flour, we have over 600 pounds sitting in storage, waiting to be processed one way or the other. We've extracted over 72,000 grams of concentrate. Put that in perspective, we could make 700,000 gummies, over 100,000 vapes, and that's in storage.
Okay. So, again, I know we mentioned some of this, but these questions were started with the pharmacy. So, to get a new product approved, I think we just steps through a lot of that process.
Yes, sir.
What was surprising to me was getting a piece of equipment approved to be used to cut out manual trimming to automatic trimming. So a product, how long does an SOP take to get approved on average? Are you seeing longer wait times, shorter wait times, or?
It gets to be, there's a big bottleneck because their staffing, I believe we've received instructions where we limit the amount that we turn in at any one given instance. So for instance, one of the issues with the trimmer is that, patients have been so excited about gummies, and we were trying to get that on board that they've been looking at our gummy SOP. And so we were waiting for that to move through the process, and then we had a break and we gave them the trimming SOP real quick. But it's a very linear process. So yeah, things like that would be simple kind of get bogged down in the process. Did I answer the question? Or?
Yeah. I mean, what do you think the average wait time, maybe for a product versus apparently a piece of machinery?
It's tough. I would say certainly nothing shorter than a month.
And there's no, and this is a question for anybody that can answer it. Is there any standard time? Like I know in some industries we say, look, you have to submit something and we're going to approve, and it's got to be approved within 30 days, 60 days, 90 days. And if it's not, the assumption is that it's approved because you can't sit on something that long with these industries. Is there any type of standard, anything like that? No.
Not that I'm aware of,
the department can take as long as they want without some kind of guidelines?
There isn't a standard because every state does things differently. So, for example, in Missouri, with your standard operating procedures, they want to confirm that you have them, but that's the private business's business. It's how they operate. But the state wants to confirm that you have them, so they will stamp them confirmed. I think if you look at our history in Louisiana under the medical marijuana program, there's been a heightened concern, and so I feel like the department may feel like they have to provide extra scrutiny to make sure that they're following the will of the legislature. So they're making sure that they analyze every sentence and every word and make sure that the ors are ands or the mays are shalls. So I think the will of the legislature and their interpretation of the will of the legislature is causing this slowdown in the process.
So we need to make that more clear. We need to take some interpretation out and
well, you would help the department, I'm sure, feel less concerned or anxious if you gave them the instruction that, hey, let the private businesses operate and make sure that you test this so that the patients get the right product, and make sure that you track inventory to make sure that there's no diversion or sale out the back door. Those are the primary concerns that the operators would see as being concerns for the public, making sure that there's no theft and contribution to the illegal market, and make sure that the products are exactly what they are supposed to be.
So along that line, what is the process to get the product from your facility to the pharmacies, and is there an actual transportation issue involved in any of this, or no? No.
So, I mean, right now, if a pharmacy places an order, then they have to, by rule, they have to give it to us by close of business the previous day. So we'll take orders up until about, I think, 4:30 p.m. Just because someone has to be on site, put in the manifest, and then package the order, and they can come at 8 a.m. the next day. We are interested in launching delivery in the near future to the pharmacies. But honestly, the program has been so small, and the insurance premiums for having the vehicle so large, given the specialty nature of the transportation, that it just wasn't commercially viable at the time.
Okay.
Yeah, the pharmacies provide us 24 hours advance notice. We create a manifest. We put the manifest into the tracking system. They come on over and pick up the products 24 hours later, and then put it on the shelf. So that's a simple solution, or not a problem.
All right. Again, my notes are all over the place, so give me 1 second.
I have one. So, do either of you have any excess products that you could get to the pharmacies now that you haven't? Are you in any of the categories? I guess we're jumping all over the board. I didn't even. Let me just jump. Backwards. I asked Ilera what products that they provide. What Good Day Farms? What?
Currently, we have tinctures, we have the concentrated syringes, and we have the transdermal creams. Am I missing something? I think that's it.
The creams are the same thing as topicals?
Yeah, they're two different. So technically, a topical goes on the top of the skin and doesn't penetrate the skin. A transdermal cream penetrates the skin and gets into the blood vessels and into the muscles.
Yeah, I don't know what that is. Okay, so y'all have tinctures, syringes, transdermal creams.
Yes. Now, in December of last year, we released the gummies, the gelatin chews. And we released the metered dose inhalers, the constructed metered dose inhalers. And we have not put either of those two products back onto the market pending LDAF approval.
So originally, well, we'd have to go backwards, but originally the GB Sciences of Wellcanna produced edibles.
That's correct. They were released for the first time after an extensive review and approval process. They were released in December of 2020. They sold out immediately.
And why is it? Why is there not? What's the problem with getting that to the consumer right now, to the patients?
In December, we were doing the processing by hand, the manufacturing and final packaging by hand. The automated equipment would not arrive until January. In January, we began the suitability process, which is the background investigation by the state police and Department of Ag and Forestry, and we could not get the automated equipment inspected, and we're going through that process as of today.
So once the automated the equipment is approved, then you're going to be back in that. That's your intent to.
Absolutely. The patients want it, the pharmacies need it, and we have the products in storage to produce it.
Can I ask a question?
Sure.
So multiple times y'all have referenced that y'all think that the slowdown on some of these approvals on the SOPs and the testing and everything is due to lack of employees at the ag division, right? Is that what I heard?
That's my understanding, just from what I'm being told. And I'm not an appropriations lawyer, but from what I understand, they don't get appropriated specific funding for this. So it's kind of a department that exists, and so that's just the messaging I'm receiving.
Do they get any revenue based off the amount of medical marijuana sold in the state? Is there anything that goes back to the ag department?
So if you look at the annual reports that are submitted to the legislature every February, there's a 2018, 2019, and 2020 reports. I don't know if those have been circulated to y'all, but they're available. They'll give you a budgetary breakdown that's an expense breakdown, I should say, by the Department of Ag and Forestry. I think that they report a deficit, a budgetary deficit of about $600,000. But I think it would be hard for the two of us to determine what may or may not be occurring internally. But I know what they are reporting is they're running a budget deficit. So,
but they do get a percentage of money coming back to them based off how well this program works.
Yes, both cultivators. Actually, the way the law is written, it says the licensee, which are LSU and Southern, have to pay a 7% fee. But since they're public entities, that's a nuance in the law that we solved. We remit to the Department of Revenue monthly a 7% fee on the gross wholesale. That goes into, if you look at the statute 40:1046, that goes into what I'm just going to generally call, because I don't have the exact name of the fund, but it's an early childhood development fund. And also in the statute, it's listed out that the Department of Ag and Forestry can be appropriated from that 7% fee funds to cover their expenses. In addition to that 7% fee, annually, Ilera and Good Day Farm reimburse LSU Ag and Southern Ag a $100,000 annual license fee. So in addition to the 7%, both of the licensees pay $100,000 each per year.
The 100,000, was that clear that was going to be an annual fee from the way the law was written?
Clear.
Okay.
So I know I'm doing a lot of assuming today, but I'm going to go ahead and do it again. I would assume that since there is a percentage of the revenue come back, there would be an incentive to help y'all along in the process and not delay some of these SOPs and testing, that because theoretically, if you can get gummies into the hands of the pharmacies and you're increasing your sales, revenue ends back up into the Department of Agriculture hands in order to put back towards this program. Is that a fair assumption?
You're doing a great job. Go ahead and answer that.
Sorry to put y'all, look, and it's all, all my questions have really started surrounding around the regulatory piece of this and the slowdowns. So, I know I'm asking y'all a lot of questions that probably should be directed towards the department. And I think that, I know that we've already had them in once, but I'm going to ask
You can
them.
always circle back.
I'm going to ask them to come back if
that's. This is an information gathering process, and as we get, we're obviously going to come up with new things from talking to, even with the Board of Pharmacy as well. That's not a problem.
Perfect. Thank you.
I think you are identifying, we all would like government to run smoothly, but government needs direction on how to enforce the laws that the legislature enacts.
Yeah, again, for me, it sounds like there's some delays here that we need to figure out how to fix, and we got to ask the department some specifics, because I know that only they can answer some of these questions. But it sounds like in the meantime, we also need to be figuring out how to make clear what the intent is and what we want to take out some of these roadblocks and allow this to move more smoothly and allow business to do their job.
And all of this discussion, I hope it's not lost, we do want to be tested, because the public needs to have that confidence. So we're not seeking any solutions there. We do want to have our inventory checked by a third party, the Department of Ag and Forestry. We want security. We want the same things. But I think there might be a better way to skin this cat by doing sort of what LSU did. LSU in the original LSU Ag Center, in the original contract, it was a micromanagement. It was sort of what we would call typical government. It was micromanagement, but you have to look at it in the sense of, we had never done this before, so let's make sure that we have a really, really tight constraints on it. And as Representative Marino asked Dr. Ashley Mullins about pricing, you saw there was a change in that one particular provision about pricing. Before, the LSU Ag Center, who had no institutional knowledge over wholesale pricing, they wanted to approve it. But what they saw was the operator has access to all sorts of data analytics. And they said, why are we doing this? Let's not micromanage. Let's allow the operator to come up with the information. So they decided, let's not be typical government. Let's let private business operate.
And look, I agree. I think the testing and the oversight is obviously needed. We're sending things out to the public in prescription form that it has to be what we say it is or what y'all say it is. So I'm not, but we also have to allow business to run and do their job as well. So again, look, this is the most I think I've used the microphone in the last 2 years. But
you're doing good. Keep going.
Thank you. But I would like at some point to have the department to come back and answer some of these questions. One last question before I give up my record time on the mic. It was referenced earlier that once the flower comes to market, that we will see or historically you see a significant increase in patients, the patient count. Do both of y'all feel as though that the product that you have on hand or capable of growing is going to be sufficient to meeting that market need?
Yes, sir.
Yes, and I have a 57-page handout that I'd like to go over in excruciating detail with you.
I'm going to have to
we
leave.
are
I'm
going to go
sorry, I
through
gotta go.
your presentation that you have. Let me just jump over to Representative McFarland before he forgets what his question is.
I think Representative McKnight has gotten most everything I had. But look, Mr. Irving, I appreciate putting into layman's terms, your processing and the fact that you did answer my question on the SOPs. And maybe what I'm about to say is as much a statement as it is a question to both of you. As someone who has sat on appropriations for 6 years, I've seen the budget. I've seen us go from a tremendous deficit 6 years to go to where we are now. And in LDAF's defense, their budget since 2004 to 2007 has been reduced by nearly 75%. Now, I want to we sit here and we talk about a lot of things, and are they experiencing a deficit in administering and oversight in this? Yes, I do believe they are. So we, as a legislature, have to do, and you got several members on this committee that sit on appropriations. We have to do a better job of sitting down with LDAF and finding out what are the financial resources they need to administer this program. Then we need to eliminate the obstacles that we as a government have put in your way. That is not the role of government. And, this is a red meat issue for me as a business owner. It infuriates me that we create these problems, we try to legislate, and we stumble over our own feet most of the time. So what I'd like to see is at some point, and I don't know how we do this, Mr. Chairman, but at some point after this hearing today, and I know we're going to have LDAF come back, I'd like LDAF, the growers, and us to sit down in a room, and it doesn't have to be a big room like this, and write it down on a piece of paper. It's not complicated. And if you all are willing to do that, and I believe you are, and I believe LDAF is, and this has been dragging on for quite some time now, ever since I can remember. And it's got to stop. And it pains me to come in here each time, and that's why Representative Marino, part of the reason he created this commission was to get in front of some of this. Look, this is a snowball that is rolling down the hill. And it is growing, and we're going to get ran over by it by every state around us because we can't get out of the way. So, look, I feel the pain. I sit on, like I said, I sit on appropriations. I see every side of it. I understand LDFs, some of their issues with it. And I'm not going to get on them because they're not here to defend themselves. But at the same time, we all need to get in a room and have an honest conversation and stop. That's what we owe the public. I'm sorry I took so much time lamenting.
No, that's okay. Nobody clapped when I was talking, but that's okay. Representative Vilio.
Representative Marino, if I could share, my support is for the department. Any business that's being regulated by government, that regulator needs to be appropriately funded, or they can't do the job that they've been asked to do. Also, we need to make sure that everyone has clear instruction on what it is government is or is not to be doing, and that will relieve some of that pressure, both funding and instruction.
And I second the comments of Mr. Davis. I mean, our interest is making sure they have what they need to make sure we can get what we need. And it's going to be a collaboration with the regulator always. It's always going to be a regulated part. And I hope I don't come across as unsympathetic to what they need. That's why I wanted to point it out. So I appreciate your comments very much, sir.
Yeah, go ahead. We'll go back.
Yeah, so our Speaker Pro Tem, McGee, had, looked at putting a tax on medical marijuana. Now, we all talked about the funding resources and all that. And I'm not advocating for a tax. But what I am going to advocate is that we have to have a way to fund some of these things. And, if that's part of what it's required to fund LDAF, then that's what we have to do. But by doing that, we're going to streamline the process. And it's going to generate more than enough revenue to backfill it. But thank you, Mr. Irving.
Okay, now Representative Vilio.
Thank you, Mr. Chair. For each of you, what amount of the patient population could your existing excess products serve? I just don't know how to
No, that's fine.
quantify it.
Existing on hand. If we didn't grow anything moving forward, we would be able to cover the next 6 months the first 6 months of 2022. So I guess the next 8 months if we didn't grow another plant.
Same for you, Mr. Davis.
I think the answer is better described in my 57-page PowerPoint.
No, I was actually just going to go to that after Representative Vilio finishes the questions, because I can see from your slides you have produced some slides on market capacity, and I'd like to do that. If we could maybe just jump to that, Representative Vilio.
I'm sorry.
The answer is that both Ilera and Good Day Farm would be able to, even if we stopped production today, which in fact both of us have from time to time, we would be able to satisfy the next year.
And it's not 57 pages on my end, but
no, it's not.
I did prepare some information on the data that I'm using to make these. It's a Florida to Louisiana state comparison, since they're a state that had existed for a while and then had flower come online, since I think that's the big thing we're all looking at. And what I did to make this, and I have a PowerPoint I can go through too, but basically we took their growth rate that happened after flower took online and we applied it to where Louisiana is, and we based our metric assuming that growth rate happened in Louisiana. And even in our current facility, if we didn't do anything else, we would be looking at like June of 2023 before we would have to do anything.
Yeah. And
sorry. My apologies.
Absolutely, seatmate.
Thank you. And either of you can answer this as well. The framework for this industry in Louisiana is through legislation enacted, as I understand, I think in 2016, correct? It started in 2015, but then the current framework is 2016, is that correct?
Yeah, 15 and 16, that's
Okay.
right.
In 2015, the bill passed, but it still had prescription in it. So the program didn't really come to take life because that was federally illegal and couldn't actually happen. There was a separate bill done in 2016 that removed it, and that's why the universities opted in after that bill, because not until 2016 was it even legally viable.
And it has a sunset provision of 2025, as we've talked about, correct?
Yes, ma'am.
Would you agree companies looking to do business in this state look to consistency and stability of that kind of legislative framework?
Absolutely. I think just observing the legislative body, you all constantly discuss stability, predictability. Does that attract investment? Does it discourage investment in Louisiana? So clearly having a 2025 sunset review with this framework, it encourages investment in this so that LSU Ag Center and Southern Ag Center can satisfy their mission of supplying the Louisiana patient demand.
And we talk a lot today about regulation. And what I want to say first of all is it's no secret to everyone. I have law enforcement concerns, so I'm really glad to hear that you're supportive of the security measures, just not the time frame that it takes. And I've come a long way, as my seatmate will tell each of you, in my approach to medical marijuana. Now, with that said, I kind of want to move over for a minute just to economic development in general. And my first question to each of you, and Mr. Irving, clearly this is a long-time passion of yours.
Yes, ma'am.
And I know that your interest clearly, as is Mr. Davis, but you of all people, your interest is patient access to medical marijuana, no doubt.
Yes,
I don't
ma'am.
think anybody could question that. So as each of you have looked at models across the country, from those numbers and an educated forecast, can the 2 licensed growers meet the projected demand through sunset?
Yes, ma'am.
Yes.
What is the projected demand? When you say you can meet the demand, what are you projecting the demand to be? Because, well, I mean, that's a whole nother, I don't mean to be interrupting you, Representative Vilio, but it's a whole nother aspect of talking about what the program is right now with the products that we have, and then flowers changes the game.
Can I put the
Yeah, let's do slides. Let's do slides, and then we'll come back to questions. Is that okay, that Representative Vilio? You gonna?
Yes,
All right,
Mr.
thank you.
Chair, the chair.
Stay.
We
I'll let
know
you
my
come sit in the chair in a minute
personality.
when I go use the restroom.
We know
and you
my
can
personality doesn't like to be interrupted, but I'll manage.
Thank you. Yeah, we going forward, if these presentations these also need to be emailed so that staff has them as well, so that they can have a copy of these as well. So if y'all could, but Mr. Davis, you had a presentation which is not. It's what, six slides long, 5 slides.
if I have my presentation, it's up on Ms. Snowden's laptop. I don't know if we can switch back to it. Is that possible?
I'm not the technical person. We have to get him back in. We want to do that. Why don't we just jump over to Representative Johnson real quick for a question while we're doing that?
Oh no, we're good. My question kind of was in line with the projections, and I was gonna wait till after they presented.
Yeah, maybe I can continue and just not deal with this.
There's anarchy in here. Okay, let's go back to Representative Vilio. Go ahead and keep asking questions till we can get the slides ready.
Thank you, Mr. Chair. So placing my law enforcement concerns aside, it would seem to me.
Is your microphone on?
Oh, he didn't. He probably doesn't want to hear me. Is my microphone? Yeah. Okay.
Tony, you got to put your face in front of it. That's how it
Okay,
works.
that's how it works.
Like this. And
It's always helpful with vertigo to do that. It would seem to me, if we're talking about from an economic development standpoint and business interest in the state, it would seem to me that if we would just throw out our legislative framework that we put in place recently, would you agree that that's probably not a good signal for expanding economic development in general?
It would certainly stifle economic development as far as us and increasing the facility. I mean, like right now we're charged with meeting the current demand as it is. So we have to make estimates of what that demand looks like and invest serious capital to improve the facility. It's millions and millions of dollars. So yes, ma'am.
Now, Mr. Davis, you talked about, I don't think we ever clarified, you talked about you were waiting for approval of the metered dose inhaler. Did we talk about how long you've been waiting for that approval?
We started the process of getting approval for the automation equipment in January. In January, we began the suitability process for my new management team and board of directors. And so at that moment, all requests for equipment inspections or approval of SOPs were put on hold until we completed the suitability process. That was completed August 4 of this year, so roughly 7 months in suitability. And now we're back in the queue for having those approvals since then. And most recently, the department gave us an update to explain that it was challenged by budgetary constraints and limitation in employees, and also having to service Ilera's requests for SOPs, that they couldn't give us a timeline. So it heightened our concern of how can we assist the department with this. So that's sort of the timeline.
So based on that recent information from the Department of Ag, are we basically in the same position on approving that equipment as we were back in January? Has anything taken place to approve it?
We're still in the process. And I think that's where the pharmacies, the pharmacists who were here earlier would say, well, when are we going to get this product or that product? And we finally, we had to stop giving them any kinds of estimates because we can't control that.
Now, you had testified that I think y'all released the gelatin chews back in last December, so that would be December of 2020?
Yes.
And from what I could tell from the pharmacy, and I don't know if you can help me too, would you say that those gelatin chews were well received by the patient population?
Wildly received by the patients.
So I'm assuming your company didn't just decide to stop making them. That's fair to say, right?
As an employee who has to report to a board of directors and a management team, if I had made that decision to unilaterally stop manufacturing that product, I probably wouldn't be sitting here.
And what about the vapes? Did those come on board in last December as well?
Yes.
And same question to either of you. In terms of the patient population, how well received were the vapes?
Extraordinarily received, and Jacob can comment about he's able to release the meter dose inhalers, and he can report about the success.
Yes, sir. Ma'am. Sorry. So when they were going through their suitability process and they were focused on the chew, we were deep in the meter dose inhaler SOP approval process. We also worked very diligently with the Board of Pharmacy to clarify what a meter dose inhaler is and exactly what protections needed to be in like a vape product in order to meet the pharmaceutical grade standard. It's easily our best-selling product.
All right. So I'm assuming, Mr. Davis, same question as with the gelatin chews. Your company didn't make a business decision to just stop making those available, right?
That's right. We made a business decision to sell the deconstructed because that was workable with the regulations and the Board of Pharmacy approvals.
Okay. Thank you.
All right. So, Representative Presley, you want to jump your question in before we do slides?
Have you reached out to the Department of Ag for a timeline? You talked about the pharmacy and not being able to give them a timeline of getting products to them. Have you reached out to the Department of Ag? Because I think that's where you're saying that there was a delay on a timeline from their perspective and getting approval of your SOPs.
We have, and due to their budgetary constraints and their limited staffing for the marijuana program, medical marijuana program, they're unable to give us a timeline. They can't calculate a timeline. And there is no statutory or rule timeline similar to, say, the Department of Insurance with insurance policy approvals. There is no timeline in this framework.
So there's just not and I guess this is a question really for the Department of Ag, and I can hold it for whenever they come back. I unfortunately wasn't able to be here last meeting for their discussion. But I certainly think that's something that we need to address and make sure that there's some sort of timeline going forward so that we can get the products to the customers. Thank you.
All right. Mr. Jacob, you want to go ahead and run through it? You don't have any more copies of this, do you? For the
I
other
don't.
members?
I'm sorry.
All right. And you are going to email that to us as well so that we can at least circulate it to the members after.
This is actually Dr. Snowden's PowerPoint.
Right.
I'm speaking to it. So I'll get with her and we'll take care
Because
of it.
whatever PowerPoint it is, it'd be, if we have it before, it's easier, and if everybody has a copy, it's easier. Go ahead.
Yes, ma'am. Yes, sir. So on the first page here, this is just like an intro page, and what you've got here is populations of Arkansas, Florida, and Louisiana, the number of patients that are in the program, and then the third metric is an adoption rate, which is a key metric that's used in the industry. It's basically of the eligible population, what percentage of people are actually into the program. Then at the bottom in the yellow, you see what a projection we think is kind of realistic for Louisiana under the current framework on the upper end, when the program under the current framework would be fully mature. At the bottom on the left, you have metrics that are pulled from the Louisiana Board of Pharmacies prescription monitoring program report, and a breakdown, because we talk about flower, what impact that has, but we attached a numerical breakdown for what percentage of eligible population actually does prefer that as a delivery form, and it is a big part of the eligible population.
How long has Florida been? Florida is just medical?
Florida, yes, sir.
And how long has Florida been running?
I believe they started in January 1st of 2019. We actually picked Florida as an example, and I'll show this on my next slide. The reason we picked Florida as our example is because they operated as medical without flower for a number of time period, so that we could actually give our best estimate on what impact flower actually has as an isolated variable.
And according to I'm reading the small print for people who can't see it. So according to the document that you have, it lists that Florida's patients in the program is roughly 2.85% of the population. And according to what we have, so you have patients in program listed as 28,170.
So we listed, yes, sir. So there's
Louisiana.
Yes, sir. There's two numbers that come out of the prescription monitoring program report. One is on a month-to-month basis, and that's the 14,663, that number that was referenced earlier. In order to be on the safe side, we assume that everyone who's ever entered in the program would want to shop again if we were legally allowed to provide them what they're looking for.
Right, and that's the bigger number is the 28,000 patients in the program, which may be more than is actually participating, and that's only 0.6%.
Yes, sir. That number comes from anyone who ever got a medical marijuana recommendation and purchased one time at a pharmacy.
Right, I'm just saying that we're just being generous. We're saying that 0.6% of our population is currently participating, when we know that the national average is somewhere between 3 to 4%.
I don't
right?
know.
3.5? 3?
Lower. I think it's between 2 and 2.5.
Yeah.
Florida's actually doing a little bit better. Arkansas is at 2% right now. That's what we were describing as light years ahead of us. I'm not aware of any state, maybe Oklahoma, that got to 4%.
Right.
But I'd have to double check.
Okay. Gotcha.
Is it cool if I continue? Or?
Yep.
Yes, sir. So right here we've got Florida does something very interesting. They do weekly reports of product that's being moved, patients and prescribers that come out on their website. So we took that information, and you can see from where they first started in January of 2019, they were actually even higher than we were originally at 0.8%.
Yeah, you might want to comment on what they are, because no one can see it.
Oh, I'm sorry. I will. I'm
no
sorry.
one can read that.
In January of 2018, it was 0.8%. Flower came online, I believe, at 7/19. So if you look at 7/19 when they came out, they were at 1.1%. So almost twice what we were at Louisiana when before flower actually came in. After flower came online, it took them another 12 months to get up to 1.7% patient adoption, another 16 months to get up to 2% patient adoption, and in 20 months they got up to 2.3, and in 24 months they got up to 2.6, and as we talked about earlier, they're at 2.8 today.
So at the point when they introduced flower into their program, what was the percentage of patient population?
1.1%.
And then it's almost close to tripled.
It is slightly less than tripled, but it took a period of almost 30 months.
Right, but I mean that's the difference in that market. That when Florida introduced flower from 1% to 2.6% in 30 months.
Mm-hmm.
And we don't even know what their amounts are, or like.
Well, we do. It's actually, I'm sorry, at the bottom it lists out their poundage that they sell, and this is on I'm pulling this from the official medical marijuana update that Florida issues their government every week. So they actually list the amount of, they actually list it in ounces. I've converted it to pounds to be a little bit easier to manage. But yes, sir, they list grams of milligrams, low cannabis milligrams, which would be CBD, and then also distillate and flower.
So with Louisiana right now, we're somewhere between 3% of the patient population and 0.6% that are. I mean, 6 is the bigger number with the 28,000, right?
Yes,
so
sir.
we're somewhere between 0.3 and 0.6%. So when flower is introduced, if we're following the same range or the same projection, looking at Florida's numbers, we could go, if we went to 2.6%, I'm not that good with math, but the difference between 0.6 and 2.6 is
quite a lot. And that's why
quadruple?
Yes, sir. And that's why we use 2% as our adoption rate, because as you were stating, it is close to tripled. So if you go from 0.63%, then, I mean, really that would give you like 1 and change, but 2% is a common variable I've seen in other states. So that's why we use that number, sir.
Right. Still, we'll be tripling the patient population.
But potentially, yeah.
Potentially. Well, if we're looking at what they did.
Right. And there's some differences in Florida as far as the regulatory framework, of course, but it's the closest one-to-one comparable I could get.
Yeah, that's okay. So you want to keep going?
Yes, sir. So this is another part of Florida. So this is actually the Louisiana's specific numbers. So this is just our history. So when the program launched, we were at an absorption rate of 0.04%, or 1,864 patients. As you can see, that number actually decreased over the first year because of a lot of regulatory hurdles. And then what we did, and I can spend more time on these numbers if you want, but these are the Louisiana Board of Pharmacy. They publish them pretty quickly. But we estimate we'll get to 2% that we discussed in the end of April of 2023.
Okay.
And then this final slide is
that's assuming that starting in January that flower is available. That's what you're assuming.
Yes.
You're not assuming that it's going to be the middle of next year or anything else.
Correct.
These numbers don't exist without flower being on the market.
Yes, sir. We have been preparing to make flower available January 1st. It wasn't until the last, actually, this hearing that I was aware that there might be some rules that were taking place. But as far as our company is concerned, we will be ready to sell on January 1st.
Right. If it's all cleared with the department, right?
Yes.
Okay. Keep going. I'm sorry.
Oh, no worries. And if anyone has any questions, this last slide is really just what we took, Mr. Chairman, is just or anybody. We took basically the estimates that come from the medical marijuana update in Florida, and then we took those same numbers and applied them across our Louisiana as if we had the same growth rate as Florida, but after they adopted flower and consumed in similar thresholds, and that's when we came up with these estimates. So our estimate of the amount of medical marijuana that would be needed in December, for instance, I started in October, but I'll go with December, would be 154.84 pounds, which would be roughly a sixth of our capacity. And then in January that number goes up to 497, but that's still again less than our actual capacity on a month-to-month basis. You really you get until even if we didn't do anything else, and we've got another 4,000 square feet that's going, and if we didn't have any product on hand, we think we could supply the market entirely until June of 2022. Even if it was just us, we didn't have any product on hand, and we didn't do any expansion, and we have 800 pounds on hand, so it's quite a lot. If we didn't take any more action, we think we would run into a bottleneck and have to invest more capital for another facility. Would be in June of 2023, based on these estimates. And that's assuming that
we have a question.
I'm sorry.
Question, Representative Johnson.
Yes, sir. And Mr. Irvin or Mr. Davis, so I'm just trying to make sure I understand your projections and make sure you guys clarify. And so I'm understanding that right now we're at 0.3 to 0.6% as far as right now with patients in the state of Louisiana. And because of, and you guys know, due to other states, Florida and Arkansas, that a mature market is somewhere around 2.6%. And when you guys are getting these estimations, are you guys just estimating the patient, or that patient coming back for different products? Like how is that being counted into the projections?
Yeah, we count a full set. So, and I'll speak to this, I guess, 'cause since these are our numbers. We count a full set of products. So that poundage number that assumes we make all of our tinctures, all of our topicals, all of our metered-dose inhalers, and are selling flower and gummies. So it's like a mature market number, as if we're producing everything.
It just to make sure it's understandable too. It's for all products. This is not an analysis of the data for just flour. This is analysis of the pounds of flour that are required to produce all products.
Yes, sir. And that we look at it in terms of biomass needs, because to us, at the end of the day, it's just we grow it and then it gets allocated to a different product depending on where it's at. It might be slated for extraction. It might be slated for selling as flour or a rosin press, depending on the product.
So you're saying that pound was 497 pounds was needed?
For the month of January.
Okay.
For the whole state.
Gotcha. And you guys are saying, also saying on record that you guys will be able to produce at a mature market, how many pounds are needed?
It depends on how you define mature market. So we were going with a 2%. And so what you've got right here is it actually increases over month. So, if we looked at all the way through the end of 2023, that would be 1,418 pounds.
I know, Mr. Davis, you guys have built another unit in Ruston, Lincoln Parish, correct?
Yes.
And so you guys are preparing for this projection. You're preparing right now as for the market to slowly mature to 2.6 or 3%. So you guys are saying that once it do that you guys will be able to produce that 1,000 pounds that's needed for overall supplies. And
yes, sir. What I'm saying too is, and our current facility is a lot smaller than what they're planning on doing in Ruston because it's giant. But even with our facility, we're generating comfortably 600 pounds a month. We're going to be even more than that, close to 1,000 by the end of the year, and we have 800 pounds on hand. So what I'm saying basically is, even if they weren't doing all that, we would have it covered based on these estimates.
Sorry to interrupt you real quick, Mr. Davis. Do you have this this slide thing that you could email so that we could put it? We only have a hard copy of this. We don't have an electronic copy.
I don't. I'm not doing a PowerPoint. I just have the handout. But
right, no, but the handout. Do you have that so that we could email it to the staff so we could put it up?
I don't want to hold everybody up.
No, we can go back to questions. I was just throwing that out there because I want to go to that next, because you also you've also prepared a market and supply, and I want to hear from that and put that up as well. Thank you.
And this is my last question. As you guys have made these projections, I'm looking at the 196 physicians, and we have 9 pharmacies. You guys projecting there to be more pharmacies in your projection in order to reach this threshold of 2.6 mature market, or?
We've run different scenarios. It obviously the numbers. This assumes that there's at least a doubling. Those numbers are lower if there's still only 9.
So your projections means you need more pharmacies involved in the process. What number?
I'm sorry. We were going with 20 for these for 2023. That was just our guess. What we went with. We also even went a little bit further than when we originally estimated, which is, on the first slide, we talked about a 2% patient adoption rate, which would be about 90,000 patients in Louisiana. On our estimates at the end of December of 2023, we have substantially higher than that, showing 120,000 patients. And even that 120,000 patients number, which would be a full-fledged mature market Florida, comparable numbers would be 1,418 pounds a month.
And lastly, how many physicians as well you're projecting? How many physicians to be involved?
1,347 in the full mature market in December of 2023.
Thank you, Chairman.
Thank you. Okay, I don't see any other questions right now. I wanted. Do we have those?
I'll do it later. I can't just to give you an update. It's on my laptop.
All right. Yeah.
And I don't have it in my phone.
Well, let's go ahead and go through your presentation, but please email that to us so that we can just share that with the commission and the public.
Certainly. Is that?
Oh, I'm sorry. I'm finished.
Yeah.
Okay. Thank you. My name is John Davis. Okay, so I'm going to jump to the first page of the handout. And in the first page of the handout is page 2. It's got the 2 photographs, one of our Baton Rouge facility and one of our new Ruston facility, just to give you a bit of a background on our facilities. The Baton Rouge facility was our original facility. It has 3,000 square feet of canopy space or garden space, and it also houses the LSU Ag Center Research Laboratory, that roughly 6,000 square foot research laboratory.
So the canopy space is the actual space where the product is grown. It's not the size of the building. That's the actual.
Correct.
And all of it is done indoors.
Correct.
Okay. Is that required, or is it required to be indoors in our regulations?
I'm not aware of any requirement. LSU does require that of us, but I don't know of a statutory requirement.
Right. That's what I was talking about. The statute doesn't speak to how it's produced.
I'm not aware of any specific requirement.
Okay.
But it is encouraged, because that's probably the only way that we'll be able to do things in Louisiana.
Go ahead.
So the Ruston facility, to give you going back to Representative Villio's questions, where I said we completed suitability in August. Completed suitability in August. We purchased the Ruston property shortly after suitability was received. By September, 30 days later, with the cooperation of the City of Ruston and the State Fire Marshal, we commenced retrofitting the Ruston facility. It's a 225,000 square foot existing facility in an industrial park in Ruston. So 30 days after getting suitability, we commenced construction. 30 days after commencing construction, we were inspected and approved to begin operations in that facility. We did that approximately October 19, and we moved plants in on the 20th of October. So phase 1 is approximately 19,000 square feet. You'll see that listed next to the photograph. So phase 1 has 19,000 plus square feet of canopy.
Canopy.
Okay. Phase 2, which is occurring right now and will be completed about the time you're going into the legislative session, March of 22. So in approximately 90 days, we will have an additional 52,000 square feet of canopy for a total of over 71,000 square feet of grow space in the Ruston facility. We have a phase 3, and that capital would only come based upon the framework that we have, based upon the legislative will saying LSU Ag and Southern Ag, you will supply the demand. So in turn, that's where the capital comes from in order to supply the demand to make sure LSU and Southern satisfy their responsibility.
Part of the your plan going forward is also keeping the adult use in mind as well. That if Louisiana switches to adult use, then you'll already have a facility where you can expand. Is that correct?
Well, we need to have an infrastructure in Louisiana. And Ilera and Good Day Farm are providing that infrastructure for the cultivation side.
Right. But I am just saying that part of your plans going forward, or you're also keeping in mind that we may at some point in the future switch.
It would be
to
smart,
both.
That's right. It would be smart business sense to prepare for something that we're seeing occur across the United States.
Well, yeah, it would be bad business not to think about it too.
That's
the other
exactly
side.
right.
Right.
Exactly right.
Okay.
So we also have phase 3, which is a to be determined. That would add another over 130,000 square feet of grow space in this Ruston facility for a total of over 200,000 square feet. So that gives you a sense of the operation that we'll have in Ruston that's currently has over 19,000 square feet.
And is the Baton Rouge facility still going to be used?
Yes. So the Baton Rouge facility continue to be used. As Dr. Snowden mentioned, there's a need to have a facility in Baton Rouge for both LSU Ag and for Southern Ag Centers. It's convenient for the university researchers because they work out of that facility. It's convenient for the legislature to come and see an example of what's occurring. It's convenient for the researchers that visit LSU or Southern to come and see us.
And how is it? Before you jump over to market supply, how is it? What is the extraction method? How is it extracted? Because I'm going backwards through my slides from the department, and they have extraction. So, there's a lot of different ways to extract. So how is it done? How is it extracted?
So it's I should preface this. I am not a scientist. So it's a ethanol extraction process where essentially we take the biomass, we combine it with ethanol, we put it into a machine, it extracts out the chemicals, we put it into another machine, it extracts out the ethanol, and you're left with the chemical compounds from the plant.
Is that the same with Ilera? Is it extracted the same?
So we have two extraction methods we use. The machine he's referring to, we have an ethanol extraction unit and something called a fractional distillator. And so basically what happens is you take the biomass, you take it off of the big stem, trim it so it doesn't have the unnecessary things that would lower potency, fan leaves, and other parts, just the flower. That gets run through an ethanol extraction unit, which creates a combined cannabis oil, which has THC oils as well as other terpenes and other cannabinoids that are present in the plant. Then a certain amount of that would be loaded into a fractional distillator unit, which can examine different fractions of oil and then select one and distill off the rest. And then you can use that to make a THC distillate, which is used to make products.
So I mean, there's a difference between what you actually the raw product and then the yield from extraction. It's a much smaller amount. Right?
Oh yeah, that's fair. Although ethanol extraction is incredibly efficient.
If I understand correct, yet we're able to extract out the chemical compounds at a fantastic yield rate. Versus if you just smoke the flower, obviously that's a different analysis altogether.
Okay.
So, gave you an idea of our facilities, and so now if you go to page 3, market supply capacity, and this is very similar to the information and the data that Jacob provided you all. Both companies have access to a wide variety of data analytics. They focus on wholesale pricing across the United States. They focus on population, they focus on consumption rates. So none of the information that we're providing you are guesses. This is data that's been gathered by other states. I'll give you an idea on the pricing. Our pricing per milligram is lower than the average wholesale pricing for milligrams across the United States. That's something that as a Institute of Higher Education, a public institution, LSU is very concerned about. So we provide them that type of information so they can see where we sit. But per milligram pricing, on average, we are lower on our wholesale pricing. So if you look at the market supply capacity, we've listed Arkansas, Missouri, and Ohio as comparison medical marijuana states. And you can see there are 4 columns: total canopy, square feet, annual production in pounds, annual demand by patients in pounds, and then supply over demand. The annual production, if you see the box on the right side, the reasonable assumed production is 1 pound per square foot. So it rounds off nicely for this. So you'll see Arkansas, the total square footage of all Arkansas cultivators is 108,000. Their annual production, 108,000. The annual demand in pounds by the patients, 64,000. I'm rounding here, but you can see it's 64,444. So in Arkansas, the supply over demand is 1.68. So the Arkansas cultivators are exceeding the demand, not a guess, not an estimate, but the demand for flower in Arkansas. Same with Missouri. You can see the same analytics. And then Ohio, that they do not provide the canopy space, but we do know what the demand is. That's that 83,000. So if you look at Louisiana, we have total canopy of over 31,000. So that is a combination of Ruston, the 19,000, that is the 3,000 in Baton Rouge, and that's the roughly 9,000 just general square footage of Ilera. Now what this doesn't take into consideration is which is a slide or a page here, is what we call pip racking, basically bunk beds. You grow on a first level and you grow on a second level, which is something that Ilera does. So that effectively doubles your square footage. So if you say you have 9,000, with the pip rack you got 18,000. But just conservatively, we're not including that in this because we also have built out for the pip racking, which would double our square footage of grow. So Louisiana has 31,416 square feet of grow at its disposal right now. The projected in 2024. Now, just like Jacob's slides, we're anticipating a 2-year ramp up. Every other state, again, this isn't guessing, every other state ramps up. It's not as though flower goes on sale and suddenly, boom, you have 100,000 people. There's no state that has done that. So it would be a gross analysis, a misanalysis to suggest that we're going to suddenly have a mature market in March. So the projected in 2024, total canopy in 2024 is over 200,000 square feet. That's with our additions that we're already in process with. The annual production in pounds of flower annually is 224,000. The annual demand in Louisiana in a mature market is roughly 82,000, which shows that we are almost 3 times the demand. Based upon
So your estimates, you're projecting that by 2024, the patient population is 110,000, which is 2.37% of the population.
That's right. So that's, if you flip to page 4, you'll see that.
But Louisiana could be like some other states where they're not in the average. We don't know. I mean, they have some states that have a 9%. Oklahoma. Right? Is that not? It's not 9%.
You'd have to show me that data, but those numbers, we would have to be, as a state, in this framework, completely blow out all of the other metrics around the country.
Well, no, I know, and we're just guessing. We're guessing. We're using the data that we have, but I mean, some states' patient population is 4%. There's more than one, right?
So double that number, we still cover that demand. Double the number.
And how much? So one of the questions is, how much does it cost? What do you have to pay in fees and licensing to operate in Louisiana? Initially,
we answered that to begin with. Right. We pay the 7% gross wholesale. We reimburse the universities the $100,000 annual licensing fee.
There's an annual license fee that continues. So that's $200,000 then
every year.
That's you between the two.
In addition, we both pay our respective universities according to that fee schedule that you see in there. So in addition to the 7%, in addition to the $100,000, in addition to the $100 per employee fee to get permitted, we also pay the universities, as you saw, a very significant potential amount.
Right. Go ahead.
Okay.
I mean,
so even if you would like to double the reasonable forecasts on the numbers, LSU Ag Center and Southern Ag Center and their private partners can cover that demand. This isn't a guess. We know this based upon square footage. We know this based upon production per square footage. We know this based upon percentage of population that's going to participate. All of this is done by data analytics.
I think you've answered that, or you're showing us that you could potentially be the only supplier that's needed, but that doesn't mean that your price is going to be competitive with only 2 growers in the state of Louisiana.
Well, if you remember, I mentioned our wholesale price, as shown to LSU, is lower per milligram than the average milligram wholesale price across the United States.
Right, but more growers would I would say economically more growers would bring the cost down.
If you look at all the other states, they have more growers than us, and we're still lower than the average wholesale price.
Well, if we were in the competitive market, then they might be buying from you and choosing not to buy from the other growers if their cost is more. I mean, it's just if you have more options. I mean, we're the only state in the country that has 2 growers.
That's because the will of the legislature said this is how we want to do it by creating an
right. We're the legislature, and if we decide we want to change that, I mean, again, I understand that Ilera and Good Day Farms, that's a for-profit business. Our objective with the commission is getting the access to medicine with patients, and
I totally agree with you. I think we both do that. Getting medicine to patients, as we've discussed today, deserves a discussion regarding the regulatory regime, because we are supplying that demand. We are creating that demand.
Right, but you and Ilera set the price.
As I've said, maybe we could have an offline conversation. Our price per milligram wholesale is lower than the average wholesale per milligram price in America.
Right, but and you set the price. You and Ilera, you are the market. You're the only two coffee producers in the state that are only selling to the only 9 coffee shops in the state. So if you two decide what the price is, that's the price. That's the way our market exists. We have created a monopoly in Louisiana for growing. Whether or not you can produce and whether or not your numbers are low, I'm not commenting on that. I'm just commenting on the fact that we created a monopoly when we started. It was the commissioner who said we intentionally made this very small and very regulated and very confined, and we only were going to do 1 license when we started. That's how we were baby stepping this along. I don't need to give a speech. I'm interrupting your presentation.
That's
Go
okay.
ahead.
I think a monopoly, though, would be what was originally envisioned with 1 licensee. We don't have a monopoly.
Yeah, I get it. 2 is not a monopoly, but 2's pretty close. 2's real close to being a monopoly. There's nobody else can come in. There's no one else can compete. There's no one else that can supply when we limit it to 2. And I know 2's not a monopoly because mono. I get that part. That's the first part of it. Can you guys touch on the labeling and packaging, just because we want to look at all the aspects of how we get this to the consumer, and I want to try to see if there's things that we should change in our regulations. So both of you are basically seed to store, right? I mean, you do the whole part. You do the processing, which we kind of touched on, and then what about the labeling process? Can you give us some feedback on that?
We have a very stringent labeling process in Louisiana, which is unlike anything that I personally have seen before. I think it is in some amount worked out as far as creating pharmaceutical products to date, but I do have a concern about how that's going to work when flower comes online, and if I could, I'd like to, expand on that.
We'll talk about why are we more restrictive than other states on labeling?
Sure. So in every other state, at least that I've been aware of or worked in, you basically have a product, you send it off for testing, you test the product, and then you attach a label that shows what the testing results are. We actually have to pre-assign milligrams for different products before they've ever been made, and then we make that product, and then it has to be within a certain threshold of the pre-assigned milligrams to each product, and then any deviation from that product is a new SKU. For instance, Shine Plus, one of our tinctures. Shine Plus is 300 milligrams of THC, 300 milligrams of CBD. Anything that has plus or minus 15% for the 300 number is not Shine Plus and cannot be sold as Shine Plus. So if I have a product that goes out for testing and let's say it's got too much CBD in it, for instance, too much CBD fails that threshold, then that product has to be destroyed or adulterated or remediated and cannot be sold. Even if it can be perfectly healthy, no toxins in it, but it's about that threshold.
So what do other states do how are we different?
Every other state that I'm aware of, you make a product and then you attach a label on it. So if I have a batch of tincture or Shine, you wouldn't pre-assign milligrams to it and say it's 300. You would send it off for testing, and then it might come back with, it's 56% THC, and then you would put 56% THC on the label. It works out this way for standardized products right now for the finished products. It was difficult to manage at first, but once you get it dialed in, we can do it. My concern is just that with the raw agricultural product, which is not pharmaceutical grade, as the legislature changed it, I don't know that I can sit in front of you right now and tell you that, I'm going to pre-assign 2 months in advance what the milligrams of a gram of Blue Kim cookies, for instance, one of our strains, Blue Kim cookies, is going to be X. And then when I harvest it, and then each gram is going to be within plus or minus 15% of that. That just seems like a tall order. And I don't know that it would work out for or at least I have a concern about how that would work for raw agricultural product, and that's something I want to get in when the public comment period for the new rules
Well,
comes in.
the raw product is a big part of it. I mean, that's and that's where we're looking for your feedback on what are we doing and how should we be doing this, because we don't want to slow down the train.
Yes,
we
sir.
don't,
And
it's
they
just
have-
saying we have product available and then the patient's not getting it, and it's going to be 6 months from now. It's not helping anybody.
Yes.
We're trying to. Do you have any comments on the labeling part of it, Mr. Davis?
Jacob covered it. Yep.
So we could change the way that we do the labeling requirements. We could make some changes in that field.
Well, anytime that you streamline government processes, it helps business get products to market. Anytime you delay that process,
All right,
it
that's
delays.
what I'm asking. I
Yeah.
want that. Tell me how to do that. Tell me. Give me some ideas about what we can do with the processing, labeling, any part of this process. This is, I mean, and I realize that when I ask you to tell me something about how, the regulations, I'm asking you to comment on the regulator who regulates you currently, and I get that's a little bit of an awkward conversation to have, but you could tell me what other states do, and show me how they're different, so that we can see and we can make that decision as to whether or not it's efficient or not efficient or a better way.
I'd love to take Chairman McFarland's suggestion and visit with the department to see what could we work on to streamline the process, rather than offer unilateral things that may not even be workable within their framework.
It's a great suggestion. Representative McKnight must have found some new questions on his paper.
I found some more space to write them down. And this is maybe not so much a question, but more of a comment back to the discussion on the wholesale price. And I want to bring this up because I think that we've identified another issue in this, and that what I'm hearing is that we have an average wholesale price. Our average wholesale price is lower, or our wholesale price is lower than the average in the United States currently. Is that correct?
That's correct.
And then I heard from the pharmacists that we're having to charge a significant, probably more on the retail end because we have a limited supply. The overhead of running a business is going to stay the same, and you only have so much product, so you have an artificial ceiling on the revenue that you'll be able to bring in. So therefore, you're having to charge prices in the pharmacy aspect to cover your costs. I know they're not at the table, but a head nod would be good. Yes. Okay. So until we fix this artificial price increase because of the supply not getting from storage to the actual retail outlet, we don't know what the real market price is going to be until we remove the regulatory hurdles that we're seeing currently, and then we'll really know what the prices are, and then I think we can attack if that's really an issue or not. But I think we have a lot of hurdles along the way before we get to that point, because when we have growers in this scenario, or you can do it wholesaler in any scenario that is holding massive amount of product back and can't sell it, then you don't really see what a true market is. And so we have a false market currently because of regulatory hurdles. And until we fix that, we really won't know the answer to that question. And again, that was just a comment that I think needed to be injected in that conversation. I'll try to run out of paper sooner for the chairman.
We as the cultivators tied to LSU Ag Center and Southern Ag Center are doing everything under our roofs to satisfy the legislative's charge to LSU and Southern to supply the market.
Yeah, and I appreciate that. I think. Look, I'm not. This is not a comment of whether 2 is the right number or 10. But until we fix the other issues, we really can't determine what's really needed, as from a supply perspective or from a price perspective, because we got all the product, we got all the supply, we have the demand, but we have an artificial barrier between the two that's creating the retail prices at the moment. Thank you.
Okay. Were we interrupting your presentation? Did you finish it? I think we actually have it so we can put it up on the screen now. Now after we've already finished it, so that the market supply capacity, the market projecting market demand, additional capacity expansion. That's the whole.
Yeah, I streamlined it to focus on providing you all with information on reliable data to show you what the supply and demands would be in a conservative way, not to suggest that we are going to be the anomalies, but what is the sweet spot in Louisiana on patient population, on demand, on participation, et cetera, and then what are the square footages of the cultivators to meet that demand. And so if you look through this, I think the conclusion is the two cultivators are assisting LSU Ag and Southern Ag supply the market demand, or even the anticipated market demand.
Can we take? All right. I guess we don't need the slides. We could take them back down.
And then we have some pretty photographs in there too.
They were nice photos. Okay. Do we have any other questions right now? Let's see. So we do only indoor growing, and that's by choice, but not by. It's not regulated that way. And is that the industry? Is that the way that most?
At least on our end, it comes from our understanding of the obligation to supply medicine to patients right now, and given the lack of a history of outdoor cultivation in Louisiana, I just didn't feel comfortable that I could sit in front of you and tell you that my outdoor crop is going to yield exact yields. So to me, the indoor is a guarantee versus where the outdoor has other elements. It is something that I'm interested in researching because, obviously it decreases cost of goods sold if you can get it right. But first, you got to build out the guarantee for the patients.
What about another part of the presentation the department did, which was packaging? I guess we talked about processing packaging. Are there any challenges with our current scheme with regards to packaging for either one of you?
To me, I'm sorry. Go ahead.
I think that folds into labeling, if that's what.
Yeah, that was exactly what I was going to say. And I know the department hasn't had the opportunity for the public comment period, so I'm going to share that with them too. So I'm not trying to blindside anybody. That concern is one I have for flour. It's just I don't know that I can tell you it's going to be consistent gram to gram because it's a raw agricultural product. I just don't think the same pharmaceutical grade framework is going to work.
So what do other states do with flour? I mean, how do they have to?
Every other state that I'm aware of, you would take a batch that was all harvested on the same day, grind it, take a homogeneous sample, send it to the testing lab, and then they would test it, and they would actually report it instead of milligrams in percentages. So like for instance, 23%, and then, that's not to say that the next batch because it's an agricultural product, the next batch of Blue Chem cookies might be 18%, depending on how the light hits it or the humidity in the air, or just different factors like that.
Okay. So what other parts of the process have we not covered, or we not want to educate the commission on from your end? And then, obviously, we've been going through it all through it as we're going along. But any other, some suggestions for how do we improve our program? That's general. But
there's a lot of work to be done on this very exciting program. Patients are very eager to get products. And I think if we all focus in on how do we streamline the process to enable the two cultivators and the two universities to provide products to the pharmacies so that they're available to the patients. If we focus in on that, I think we solve all the problems that we're facing.
Does anybody else? And this goes to you are the two suppliers for you're the two coffee companies. Is anybody else in the country limiting their dispensaries to 9 or such a small number for 4 million population? I mean, do the other states that are running their programs have any limitations on the places?
Yes. All states have limitations. Well, not all. The vast majority of states have limitations. So different states might have decided to have 45 pharmacies. Arkansas decided to have I think 7 cultivators. Every state created a framework, and so Louisiana created its framework. And then all the people that are participating in this, after going through competitive public bid processes, are complying with that framework and making investments based upon that framework. If Louisiana were to have started out, say, like Missouri, there will be roughly 10 cultivators, and each cultivator will be limited in their canopy space. Then Louisiana would have worked under that framework. But Louisiana started out with the 2 universities and the 2 cultivators and the 9 pharmacies.
Right. I'm just talking about, you know, the national average. I mean, is anyone have as few places where you can actually get it to the patient as Louisiana does?
There is marijuana policy project, MPP. I think they're at least one of the many resources, but it's one that they have different charts or spreadsheets, and my mind's eye sees where they will list all of the states and all of the limitations for each one of those states as a compendium, for example.
Representative Vilio.
Thank you, Mr. Chair. This is not necessarily a question, but a comment. I just want to thank you both for your presentations and thank each of your coffee companies for being willing to take the risk years ago and invest in order that for those who strongly believe and have passion for medical marijuana to be accessible to its patients, that y'all are at least taking that risk and making that available to the extent you can get through the regulatory bottleneck. And I really appreciate all the information. It's been very helpful.
Thank you.
The many Louisiana investors that both of these companies have, also thank you.
Very much so.
And that's a good point too. That, you know, what people, a lot of people when they're looking at the programs and everything don't realize is that because our federal government is leaving marijuana as a Schedule I drug, that changes everything about the way you do business and everyone else does business. You can't go to a bank to get a loan to build your Ruston facility. You can't, you know, insurance doesn't cover this product. We have to make standalone dispensaries because they can't be in the same pharmacy with other scheduled drugs. You know, so your business is challenging in that you have to raise capital from investors and different sources that is no other, I don't know of any other business that has to operate under the terms that you do in order to, and there's a lot of financial risk involved. I mean, I appreciate, you know, the bringing the product, but you know, but again, you know, if we're just being honest, your motivation is financial for businesses and there's nothing wrong with that, making money, but you know, my questions and where I'm going with everything that I'm trying to take a hard look at our program is figuring out how to get medicine to patients and make it accessible and affordable. But I appreciate y'all coming in today as well and taking all of our questions. And I'm sure we'll have more, you know, after we keep going further because we're not done, but we're, I think from the board's not lit up, we're done for today. So thank you.
Thank you.
So we're going to. Oh, did you? Well, we do have a public comment, and hopefully it's a brief one, or we're going to make it a brief one because we're getting late in the day. And if I don't pick up my daughter at 3:20 in New Orleans, she's going to be standing on a curb, and I don't want to let that happen. But we can. We have more cards from people that want to come in and speak. I'm sorry. Manny Serrano, MJR Corporation, Guillermo Avina, FSO, Richard Brumfield, Full Spectrum Omega. Y'all want to come up? Well, the president, actually, Guillermo Avina says present to provide information if requested. You didn't check that you wanted a speak box. But Manny Serrano, I'm present, would like to speak, and Richard Brumfield, present, would like to speak. So you want to come up and...
Good afternoon. What's it? Afternoon yet?
Afternoon.
Good morning. Okay. Good afternoon, Chair and the committee meeting. Last week I was here. They asked me to come up and
So
speak who I was.
Introduce yourself for the record.
Okay. My name is Richard Brumfield Jr. I'm from Ponchatoula, Louisiana, originally. And my company is Full Spectrum Omega Incorporated out of Los Angeles, California, and Adelanto, California. And my other company is Omega 11 Health and Humanitarian Company. I just want to set this record straight from the last time I was here. I am a cannabis researcher with the National Institute of Health and the Department of Defense. And I'm recently just been published by the National Institute of Health. So I am a cannabis subject matter expert on medicine. And also, I've been coming to Louisiana since 2014, since you enacted this, because I'm from Ponchatoula. I discovered medicine that worked very well. I went to both universities, LSU and Southern, in 2014, 15, and 16, trying to bring my product to them. But the thing about it was, everybody wanted me to give up a bunch of money. I'm about medicine. I'm here about helping people. My product works, and I have many patients throughout the United States and the world. And I have very, very many family members here in Louisiana who I'm taking care of, who they cannot afford the product they have because, one, they're not effective, two, they're too pricey. I want to come home and help my people. My family members are sick. I have a medicine that can help. I'm not here about the money. I've never been about the money. I'm about the health of the people. I'm tired of everybody asking me to give up a whole bunch of fortune that I took out of my own pocket to come up with this medicine, to make it available to people who in need. That's why I run a health and humanitarian program in California.
Representative McKnight, you have a question?
He can finish. I'll wait.
I have run a health and humanitarian program in California that I'm giving the medicine away free, FREE, because people are sick and they can't afford it in that area. I'm working with the federal government. I'm doing everything through the FDA process. I ain't got time to be going through a bunch of silly regulations that say, pay me this, pay me that, before the people get what they need. I invested my own time and money with my business partners to make this available. I've been coming to Louisiana, like I say, 2014. I know Fred Mill personally. I know Rod Burrell behind me personally. I've been talking to them since they wrote the legislation. They've been trying to give me advice on where to go. No one would listen to me. But now I'm a proven case with the federal government, and I want to come home and bring my medicine to my people here in Louisiana. Make a way for me to come home. That what this mission should be about. Making a way for me to come home to bring my medicine to Louisiana that work. And I have the backing of the federal government behind me. And that's all I have to say.
Okay, Mr. Representative McKnight.
All right, just a quick question. You said you're giving away the medicine for free, but you also mentioned that you didn't want to give up money to go through the established way we have it. So I'm sure they're not. I'm sure if you talk to them, if you're willing to give the product away for free, I got a feeling that they'd probably take it from you.
Well, if I'm paying everybody money to get in the program, I don't have no money to make the medicine. So what the heck I'm giving you all the money for? Well, I can use it to benefit the people that need it.
Okay, I was just curious. I was trying to understand the two, because in one hand you were giving it away, and then there was money involved. So I'm not I guess I wasn't understanding the connection there.
Oh, I have certain people here, and I'm gonna let Manny speak next. Manny Serrano worked with me in California. I want to let them speak to what I've been doing.
We are self-funding it. My brother and I self-fund the program.
Okay.
We believe in the product. We believe in
Go ahead,
making,
Mr.
medicine.
Strano. You got to introduce yourself again, please.
Okay.
I'm sorry.
It's okay.
Greetings, Mr. Chairman and members of the Commission. Thank you for allowing me to speak with you today. Manny Serrano, Vice President of Government Relationships with MJRX Corporation, a vertically integrated licensed cannabis company, a seed-to-sale company. Last month at this Commission meeting, the majority of my time was on giving you vital information on who we were. A portion of that time was about full-spectrum Omega biobotanicals and the two products in federal labs. A tincture for radioactive countermeasures, a topical lotion for wounds and burns with the Department of Defense, U.S. Army, but we were restricted by the federal government about how much information and efficacy of this medical breakthrough product. We are indeed excited now that this past October 3rd, 2021, a medical conference in Puerto Rico with emphasis on radioactive countermeasures and pain management, the National Institute of Health published a paper and reported FSO full spectrum Omega Elixir product outperforms opiates with no side effects. National Institute of Health stated that they do not know the full potential of this product. Possibly it will have the same results with cancer patients. Full spectrum Omega bioidentical products are in all these federal labs with signed agreements. NIAID, National Institute of Allergy and Infectious Disease, USAISR, United States Army Institute of Surgical Research, WRAIR, Walter Reed Army Institute of Research, and last, LSU, Health Scientific Center.
I don't want to interrupt you, Mr. Strano, but you're making me nervous with that stack of paper in front of you as to how much you're going to read to us today, how long we're going to be here.
Maybe a few more seconds.
All right, that's fine.
Thank you. FSO Bioidentical has letters of support from over 28 U.S. congressional representatives and over 5 U.S. senators. The inventor and founder of this product is a homegrown genius of this fine state of Louisiana. Mr. Richard Blumfield wants to bring this breakthrough medical product to Louisiana. Mr. Blumfield wants to manufacture this product in his home state. Mr. Bloomfield wants to provide this medical product to the citizens of Louisiana. Mr. Bloomfield and MRJX receives calls from Canada.
All right, so let me just interrupt you for a second. What we're not doing in the commission is doing infomercials or commercials or taking applications for growers or taking applications for pharmacies or distributors. I mean, if you want to talk to us about our program, thank you. But this is not going to be the forum where we're going to have people come up and ask. We're not running commercials.
What I'm trying to state here is that he's into federal labs. We have real medicine that we want to bring to Louisiana.
I appreciate that. Yes, sir. I'm just saying that let's keep it confined to talk about our program and tell us what we can do maybe to improve it.
Mr. Chairman, what I'm going to do is I'm going to leave this binder here for you with all that information on the federal labs, and that he wants to bring this product here to Louisiana. Real medicine.
I appreciate that.
I want you to share this with the commission, but I ask you not to make reproduction copies of this.
Not a problem.
Thank you so much. I appreciate it.
Thank you.
Thank you, sir.
Thank you, gentlemen.
Any question? No? Good.
Yeah, they just told me that if you give us that, then you're making it a public part of a public record. So if you don't want to do that, you may not want to give it to us.
I'll give it to you.
Okay, that's fine. I just want to make you aware that if you're turning that over to us, it becomes public. So we got 2 left. Blaine Jennings, present and like to speak, and John Ford, present and like to speak. Yeah.
Good evening, Chair and rest of the committee members. My name is John Ford. I am the CEO of Black Farmers Hemp out of Lafayette, Louisiana. We currently are a licensed grower here in the state of Louisiana, but I'm here to talk about your medicinal cannabis program. As I listen to the testimonies of the universities and the growers, I am a little concerned about the opportunities for limited resource farmers and pharmacists. I think you were right, Mr. Chairman, about a handful of people controlling the whole industry in the state of Louisiana. We have farmland that is not in commerce, black-owned farmland that is not in commerce in the state of Louisiana, and I think that we should be looking at how we can use this cash crop and this medicinal cannabis to cultivate our communities. It's one thing to be able to grow this crop, but if it's not benefiting our communities and the people that we are anticipating to help to purchase this medicine, then we're defeating the purpose. I think that we really need to look at how we can work with the current licensed growers and the university in expanding opportunities for minorities and finding a way to allow us to participate. I appreciate the early investments that both of these companies have made, but there are small investors that would like to invest also in themselves. And I feel that we need that opportunity to invest our resources along with these companies and the university to make sure that we take this medicine that was criminalized for so many years and give us an opportunity to benefit in the communities that was damaged most by the criminalization of this medicine, to have an opportunity to participate and be a part of this growing industry. Our communities need to be a part of it, of this opportunity, and hope that you all can look at the total equity piece as it pertains to how we allow or invite more opportunities for both minorities and non-minorities to have an opportunity to engage and use our talents to make sure that this program is successful in the state of Louisiana.
Thank you.
I'm Blaine Jennings with Virgin Hemp Farms. I'm also located in Lafayette. I know Mr. John Ford real well, and I second everything he said. I'm a licensed grower, seed producer, and processor here in the state under the hemp program. You know, I heard a lot of information, you know, and I know y'all are looking for solutions. One, just straight off the top, is I don't know why the Ag Department is overseeing this medical marijuana program. It should be the Department of Health. You know, so that would be my first change. I had them at my facility yesterday, and it was a simple question of, hey, how are you going to wash your trimmer? I said I sanitize it in alcohol, then wash, rinse, and sanitize again. Okay, and I didn't have to go through a SOP process of 4 months for that point to get across. So
We have a question from Representative Presley, who won't sit in his regular seat.
I like to move around and keep you on your toes, Mr. Chairman. I just want to clarify. So you had the Department of Health that was at your facility?
Yes, sir.
So they regulate the hemp industry?
They are taking over the consumable hemp processor's license away from the Ag Department, effective, well, they're developing it right now. So by January 1, all that should be in effect.
Okay, thank you.
Yes, sir. You know, some other things that concern me are cost, quantity, and quality with the two growers. You know, I didn't hear any retail prices, so I'm going to give them to you. Since my last meeting over here, your first committee hearing or second, I've had 4 people I know go and get their license, or the recommendation for medical marijuana. One half-gram cart of a vape pen is $100. Okay, the black market price for that for a full gram cart is $40. Okay, so the reason I bring this up is,
you're going to end up getting people, that will get their card or their recommendation so they could go and buy some flour and have that bag, and then they'll just get black market stuff and put it in the bag, and that'll be their pass from getting arrested. So if we don't keep control on cost, it's going to end up diverting these people to the black market. So, for example, in California, the recreational market in California, the legal recreational market is $4 billion a year. The black market is $8 billion. It's double, and that's because of regulations. It's so regulated in the recreational industry over there that the black market is double the size. So you're missing out on all these licensing fees, all these tax dollars, everything because of regulation driving it to the black market. Okay. In Oklahoma, there's 6,000 licensed growers. 6,000. They pay $2,500 for a license. That generates $15 million right there just in licensing fees. So right now we're set up where we have 2 growers at $100,000 a pop plus some 7%. I know that's going to generate something, but it's not $15 million. Now, I'm sure Oklahoma has taxes on top of that. That's just the licensing fees.
Well, Oklahoma's the Wild West, and I don't want to have anybody say that we're going to jump from 2 to 6,000. I mean, we're not. I can promise you, I'm not much of a fortune teller, but I know Louisiana's not going to make that kind of a change.
And that's fine.
And we're probably going to be making recommendations that are very conservative.
I'm just trying to give you comparisons opposed to the Arkansas that they keep going to.
Yeah, I don't like to use Oklahoma in any comparison though, because they're an outlier.
But why do we use Arkansas? And
because they're a neighbor, probably. Because that's where people are going to cross the border to purchase if we don't have what they want for what they price.
And I would argue that they're not going across the border; they're just going black market. They're
Yeah.
So. I appreciate Southern focusing on allowing the growers that applied to be mostly local people.
Let me just say that we're gonna, just for the record, that we're gonna give back the binder back to the gentleman, and we're not gonna keep that or publish it.
Okay. So I appreciate Southern focusing on local people. When they accepted bids for this, LSU. When you pull up Good Days LLC on the Secretary of State, out of the 6 members, 5 of them are out of state. There's only 1 here in Louisiana. And so I take offense to that. The reason they only had 5 people bid is because when you're limiting it to 2 growers and you have to come up with an absurd amount of money to get into the game, you're only going to have 5 bidders, but if you could allow more boutique growers like John Ford and his crew, me and my crew, among others, you're going to have a better quality product because it's a smaller farm. You're going to have more competitive pricing, and I think you're just going to have a healthier environment and a healthier business. And we're regulated just as hard as they are in regards to the quality of our product. We still have to send in a COA for that flour that certifies it's a certificate of analysis. It shows if there's heavy metals. It shows if there's pesticides. It shows if there's mycotoxins. So the end product will be clean and pure, and the COA will show it. So we're already doing that on our end in the hemp industry. It's nothing to just transfer over to the medical industry. We would probably have to add more security cameras, but besides that, also have a discrepancy with the quantity that LSU and Southern are going to be able to produce. A pound a square foot, I think, is really too much. The gentleman, last time he was here, estimated that we need 2 million square feet to produce enough. And so we're only looking at 200,000 square feet of canopy space. And I pulled up some averages, and it's 40 grams a square foot. Based on LSU and Southern's canopy space of 30,000 square feet, that's 10,000 pounds a year. So to give you an example, I mean, our law is allowing you to get 5 ounces a month under our current program. At 15,000 patients, 5 ounces a month, I think comes to, I don't know, they wouldn't be able to supply that. So based on our current patients, based on our current allowances of what the law allows you to get from the pharmacy, they wouldn't be able to supply it. They only have 600 pounds in the freezer. Somebody else had 800 pounds. So I might be jumping the gun on supply-demand issues, but it's very easy to get your recommendation. I mean, you call Teleleaf and over the phone, you don't even have to go in person, and the next day you're in the pharmacy. So as the word spreads, I think it's going to be a little more demand than y'all are anticipating.
I don't want to. I mean, I apologize for cutting you off, but I've got to.
I know you got to
wrap it up. Yeah, I got to get on the road.
One last.
And we're gonna have another meeting. This isn't our last meeting.
Yeah,
we're gonna schedule our next meeting as soon as we finish. As soon as you finish.
But that's a lot of good info. And if I implore all of you on the board to download an app, because there's pretty much an app for that, right? As the saying goes. But Leafly, write it down, download the app. You could pull up a map of any geographical area. You can see how many dispensaries are in the area. You can see how many, what the prices are. There's some very reasonable prices out there. And I did not hear any prices on the flower from these 2 growers. So Oklahoma, the reason I brought up Oklahoma is 6,000 growers. An ounce over there is $240. Okay, so we haven't heard anything on price yet from them on the flower. We don't know what they're going to charge.
Representative McFarland. I mean McKnight. I'm sorry. I'm reading. I know you are.
Look, and this is just a quick comment because I know we're doing another meeting, but as you referenced last meeting we had, I can't remember the individual that referenced the 2 million square feet, but I remember that comment being made, and it wasn't from either the growers, it was somebody else. Yeah. Exactly. And then you made a reference to what you thought the discrepancy of the canopy space and what the production is. I assume you're going to be back at our next meeting.
More than likely.
Okay. And anybody else that's going to come back, if you have those numbers, look, I get a printout here with all our growers' numbers on it and the math and where the data comes from. If I need it, I'd like to. If there's contradictory data and numbers, if you could provide it to where I can look at it. I'm a visual person and I love data.
Okay.
So if I'd like to see that contradictory information and where it's coming from, so that I can compare what I presume is what they're seeing their production is versus what you're seeing in another publication or a number studies. So again, I just would like to be able to take more time to look at it and understand it.
Sure thing.
Thank you.
Okay. And I could be done so your daughters are not
I
standing
appreciate
on
that. Yeah, she don't want to be standing out there looking for a dad. It doesn't look good.
Thank you.
Thank you, gentlemen. So at this point, we have to schedule the next on the agenda would be we want to bring in the physicians and also invite patients to come in and talk, and then we can go further into more of this, and we might even be requesting the department to come back, Department of Agriculture, maybe at that meeting. We have to look at that, but I'm just telling y'all right now where I'm thinking that we're going with the because we're gonna run out of time, and then we're gonna hit the holidays, and then we got to make recommendations. So right now we sent out an email tentatively saying that the 19th might be our next meeting date. I don't know how we didn't get a response back from all the committee members, maybe just one. But I'd like to schedule that right now, and if we need to, and I'll talk to the rest of the group, which they're not all here right now, if we need to change that, we'll change that and publish that before. But right now, I'm thinking that would be our next meeting date. Well, that's not a good day. We're not going to have to we're going to have to come up with another date then. no, and another, and Presley's going to be a no. So I don't think we want to have a meeting with just me. It's not a good meeting. Or we're going to have to. Yeah. So all right. Well, we're going to have to do the date. No, it doesn't have to be a Friday, but we're gonna adjourn today without the date, and we'll have to just publish it when we get a consensus from the group. Do we have a motion to adjourn? We do have a motion to adjourn in a second. Thank you, ladies and gentlemen. We'll continue to go forward, and in the future, if anybody wants to have anything that they want us to look at or a PowerPoint or whatever, it would be good to try to send that to us in advance so that we can have it available in printouts for the members. Thank you.